Good morning, everybody. Welcome back for budget deliberations, Douglas County Commission's 2027 budget hearings. Today is Monday, July 13th, 2026, and hope everybody's feeling nice and rested after the weekend and has all their thoughts in order for now. And with that, I will kick it over to Sarah to start us off.
Thanks, commissioners. Appreciate everyone getting their worksheets in. Many thanks to Brooke for getting it all compiled for us today. We would like to start with a conversation. Brooke, maybe you can throw up the compiled list. We'd like to start with a conversation about the delinquency rate. There was a majority of commissioners that had some interest in adjusting the delinquency rate. You might see if you can make that a teeny bit bigger, Brooke. And then we can, because the way it works on that impacts the mill, and it's pretty complicated on how we have to adjust this. So I think it would be easier for staff if we could start with that conversation, and then go from there. And Brooke, you might try to describe it a little better than I just did.
Certainly. There were a couple of commissioners that did express interest in reducing that delinquency rate, and that does affect the overall mill levy calculation. And so as staff works to set that maximum mill levy rate for the revenue neutral rate, notices that will go out to all taxpayers in Douglas County, this will be an important first step in determining that mill levy that we'll send out to those. So staff is looking for some majority on that delinquency rate so that we can plug that in kind of at the offset here, or onset.
That expressed interest in doing that. So
do you mean two commissioners at the same reduction rate and then another commissioner, or just two?
No, just
two total.
Two total.
And I know that it seems weird to start with a two, but because of how this impacts the entire spreadsheet, would just be good for us to figure this out or not figure it out.
Well, I was probably one of the two. Since it's been one, actually, for the last 3 years, I see no reason to have it at two. This is my basic theory.
And I was one, I put it at 1.5.
Well, for me, I mean, my takeaway from Friday was that was what I left hearing was that Commissioner Willie was at 1.5 and considering or planning for that perhaps, and Commissioner Dorsey wanted 1%. And then Commissioner Anderson, Commissioner Kelly, and I were all open to the idea of it if we needed to lower the delinquency rate, but not yet committed. So I think for me, I had sort of tucked that away as a later conversation because I'm not sure that there will be a majority that wants to adjust it. So, but I want to hear from other commissioners too. Maybe.
I think I actually put it in my spreadsheet at 1.2 or 2.5. I forget.
I saw the 1%, but it could have been a rounding where it was just rounding to 1% because I didn't go out.
I think I put in 1.25 and it went to 1.3. So then I went back to 1, maybe is what happened.
Yeah, I appreciate that we want to talk about that earlier because of the impacts, but I thought we had a majority on it and thought that we might visit it later if that's what we needed to do.
I think that's fine. It's going to be very complicated to make that adjustment later. So and I will want some grace that it might not be 100% accurate until we have some time to look at it. So as long as the commission is comfortable with that and understands that it might not work out as easily as it seems, that's what I want to make sure we understand.
What's the rationale for doubling what it actually is?
Commissioner Dorsey, is that a question for staff?
Oh, it's a question for other commissioners.
What's the rationale of doubling what it actually is? Well, I think that a conservative estimate for the delinquency rate, and I don't think it's too conservative. I mean, sure, it's double, but it's double by 1%. It's not a significant number in the grand scheme of the budget, in my opinion. And I'm interested in managing risk.
Well, that 1% is $1 million, isn't it?
Yeah, it's not chump change by any means. Commissioners, I think I'm hearing that we're in the same place we were on Friday, and that the only way that might move for what is the current majority of the commission, who didn't reflect a reduction in that line on their spreadsheet, is that it remains to be seen whether or not we're convinced that that's necessary. And so I hear staff's concern. I think there's always space for time to give staff the ability to recalculate and triple check the math after we change something more significant like that. But for me, it is based on how the rest of the conversation goes about the budget options and any other strategies that commissioners are interested in pitching, I suppose.
I want to make sure I think I understand staff's concern, but I want to make sure I'm checking it. If we don't deal with that right off the bat and we make other changes to the mill levy, those changes to the mill levy will then impact our delinquency number, right? So if the delinquency number is based on the recommended mill levy. If we reduce the mill levy, then the delinquency number will get reduced automatically. And so I can see why you're asking for it early on, because it will give us a better picture of, but I also, as I shared the other day, sort of to answer Commissioner Dorsey's question, like I don't want to put excessive risk on our community than necessary. I also don't want to increase the tax burden than necessary. It's finding that balance point. It may be 1.5. I think 1 seems like too much to me, especially if our rates have been at 1. To say it will never go up or it's definitely going to stay at 1, I think it is more risk than I'm willing to take.
Would it be helpful to staff if we try and get to that conversation by the end of today, and then you've got kind of coming into Tuesday with some time to calculate?
Maybe, I mean, it just depends. If you decide at the end, I mean, it sounds like we're trying to reduce mill levy in some places. So I just want to say that if you're doing that, and then you decide to do this later, it's just complicated. So as long as you all understand that I'm going to need time to make sure it's accurate. But it sounds like we have a majority that's not interested in doing it. So I'm hopeful that we won't have to mess with it later. That's where I'm at.
Thank you, Sarah. Commissioners, I think it would be a good idea to start with consolidated fire number 1 for commissioners expressed interest in funding their supplemental request. If you would like to, I can show that sheet and we can start the deliberations for the consolidated fire district number 1. Bear with me just one quick moment while I get that shared. All right. So commissioners, there was a couple of different levels of funding for this supplemental request for workforce stabilization. Some of them were a little bit higher, and some of them, or I think one of them was right at the request level that they asked for, which was that 1155,239. Staff has gone ahead and plugged that value in here so you can see the impact of the mill levy for that change, and staff will be looking for direction on funding for this to set the mill levy on Wednesday.
Brooke, did I remember to put something in on this? Okay, thank you.
Does that include the potentially one-time costs as mill levy or as one-time?
Think
It's in a mill levy because they don't have the reserves, I believe.
yes.
You could always change that in a future year. If you wanted to reduce their mill levy, you could.
And so the 9.442 was their request A. Okay, because there was some thought that it might be higher than that.
I think I must be the commissioner that had the additional value because based on our discussion Friday morning, that 130K should be added to the 1.15. And so I added it there because that was the number that was reflected in the request. So that's why I put 1285, but I trust that staff will determine what the accurate number is to fund that option as we determined.
Actually, Brooke Jake's telling me that it does not include the one time. And that if we include the one time, it's a different number. Jake, we have an extra mic. You want to come to the podium?
Yeah, it's on some of their spreadsheets too. It's the 1,285,239.
Yeah, Jake was confirming it is 1,285,239, which I've summed here in the bottom right-hand corner of this page. It includes the 130 that staff had earmarked out of cash basis reserve, which would hit fund balance. Staff would be fine plugging that value in here if commission desires.
I'd like to double check what that mill value is, the impact of having all that together.
Do you have a delinquency rate on CFD one?
No, not at this time.
Didn't you
Does that
shared
mean
the,
there isn't one, or you just don't have it calculated?
I recall last week that I think staff shared that it was like 0.32, so very, very small, and they didn't calculate it in.
So we've got the one time in there as one time, and there are sufficient reserves to cover that. Are you sure?
I think our discussion from Friday was that those aren't necessarily one-time costs. Then you have to build in the schedule of replacement of PPE and onboarding and training, and that like all of those things might maybe
Be
in the short
ongoing.
term might be one time, but they're going to have long-term implications. And so I thought we were going to wrap it all up together.
Yeah, that's my takeaway too. So I think we really got ourselves tripped up on this on Friday. But my conclusion in my notes reflected that there was consensus or majority that the 130 would be added to that 1.155 that was included on the spreadsheet, and that was really the intent, and that's how the budget was written. And there was agreement that those ongoing costs should be considered ongoing and go ahead and impact the mill if we're going to make the raise. So I believe that number that you just plugged in is accurate now, right, Brooke?
Yep.
And reflective of the 130, so we don't need the 130 line that was
Got it.
further down there.
Yeah.
Okay.
Thank you.
So that changes the mill to 9.830.
Correct.
Okay.
And
So-
my understanding was at the end of Friday, we had 4 commissioners at that amount.
I concur.
Okay, so we will prepare the materials for the R&R notice for CFD 1 with that number.
All right. Thank you, commissioners. I'm going to share my screen again. And so there were a number of items where all 5 commissioners shared majority on some line items, but there are some areas where there was, or there's one line where there was a reduction in funding, and that was for the Lawrence Community Shelter. staff has gone ahead and plugged in those values for those line items and would be open to any conversation about that.
Can you point us to the number, that line on the spreadsheet for Lawrence Community Shelter?
Certainly, bear with me just one quick moment. 75, row 75.
I don't think we have those plugged in yet, do we, Brooke?
I don't have any changes for Lawrence Community Shelter.
So there, oh, I see. I'm sorry. I think I'm at, let me see. Okay. Sorry about that, commissioners. We'll skip that one. Moving along to the values that are noted as a 4.
Well,
Brooke, just to make sure I'm clear that
Yeah.
you don't need any further
No,
clarity
I'm
about
sorry.
the 5.
No, I
Yeah,
think
for
we
the
do.
5s.
yeah, Brooke, I think we do on the
Okay.
behavioral health,
Okay.
on the community
Thank you.
shelter. So 4 commissioners look like they move it to the behavioral health fund, but Commissioner Dorsey, you moved half of it?
No, I reduced by
Okay.
137,000.
So you're recommending cutting the
Yes.
community shelter?
Well,
That's what we wanted
I
clarity,
used the money elsewhere in the budget. Let's put it that way.
but you're reducing it from LCS?
Yeah.
Okay. So, and then moving just 196,000 to the behavioral health fund.
Well, I think we had 237 total, right?
No, it's 236. The
36.
Well, and that's 296.
96.
Yeah.
Well, I thought I had 236 or 37 on my spreadsheet.
It says 196.
Let me get the right glasses.
So, and I don't know that I flagged it on that line. My intention was the 4 items that were
Oh.
flagged in our
It
decrement
was
list
296.
to move those expenses over, but
Okay,
I calculated that in a different line, so I don't have it there. So
Okay.
yes, I'm on
Okay.
board with that.
So-
I want to try and
200,000.
make sure we're having one conversation at a time.
So, yeah, that's what I thought. Commissioner Dorsey was recommending that we reduce funding to the Lawrence Community Shelter down from 296 to $100,000. So,
Correct.
and then move just that 100,000 then to the behavioral health
I
fund.
didn't really have an issue one way or the other.
Okay.
Although I do think many of the people in the community shelter have behavioral health issues.
Yeah, and that's why I think most of the other commissioners moved it to the behavioral health fund. But I just wanted to, we didn't have a complete consensus of all 5 recommending the same amount. So I just wanted to talk about, make sure that everybody understood that.
I also moved it to the Behavioral Health Fund, and I also suggested a reduction in funding as well. So I'm not sure if others suggested a reduction in funding.
Just
Okay.
Commissioner Dorsey.
Okay, all right.
Commissioner Dorsey and you had mentioned a possible reduction on Friday, I believe.
Yes.
So I anticipated
Yep.
that potentially from you, but
Yeah, I did not go all the way down to flat 100,000. I think that's a little bit more significant. I was doing a graduated reduction for several community partners to encourage more braided funding and a better understanding of their budget detail for individuals or organizations that are not showing as much detail in their budgets so that we can move towards more transparency. And then for those that are truly more in line with the behavioral health funding bucket, moving them to that particular funding line. And then especially when we have integrated crisis, integrated care coordination, supportive housing projects, and then community-based intervention services, really seeking to bring some of those projects more in line as well.
Well, I appreciate knowing that and understanding that that's your approach, and that it sounds like it's your approach with several partners or lines we might talk about throughout for for the 5. That's the only one that there was some variation on. Is that correct, Brooke? That line of the 4 items that you have as 5 commissioners supporting. So as I understand, we have all 5 commissioners supporting moving it, or at least 4 commissioners support moving all of those, support moving LCS to Behavioral Health Fund, and 3 of us support funding it fully at the request, correct?
That is correct.
And then no other variations to note or for us to discuss about the other 3 items?
Mm-mm.
Okay. Unless any commissioners have any other comments about that, I think we can move on to the list of 4s and let us know what clarity you need in particular, Brooke and Sarah.
I had a question for the chair. I wondered, in my mind, I kind of had different funding philosophies for within the behavioral health fund versus in the general fund. If we go through this, are we bouncing back and forth between the two? Can people follow that okay? Or should we focus on one or the other?
Fair question. I think I'd want to hear from all commissioners about that. I personally can oscillate between the 2 of them, but I'm keen to focus on just behavioral health projects and then scroll back down and go through general fund. If other commissioners have a preference, I'm interested in hearing that.
I'm fine going back and forth. It doesn't bother me.
I'll work to keep up.
We can slow it down whenever necessary. Sometimes we have to rewind the tape a few times so we all hear the same song. All right, Brooke, what do you need to know from us, or what is of note in the 4 category?
Thank you. We do have some interest in moving program funding mostly. This would be specific to the Administration, Housing and Human Services Division, the Lawrence Douglas County Housing Authority, tenants to homeowners. Also, the Kansas Holistic Defenders, the 20.
Let's just take them one at a time.
Oh, sorry,
So,
Commissioner.
yeah. So,
So moving some of the community partners that are supported in the general fund right now, there was some interest in moving those programs to the behavioral health fund, specifically the top 3 items listed here. And again, that 321,032 is for the permanent supportive housing program.
and does that include the financial empowerment program? That was a
No,
budget.
there was a commissioners, there was a consensus of, or I'm sorry, a majority of, I think 2 or 3 to support that program. It's going to be higher on the list and we'll talk about it in a little bit,
So really,
but they were on the same line.
Yeah, they were on the same line. So like, for
Okay.
example, I had made a note that the math I did was I reduced that line by 301,032 because I wanted to fund the 20,000 empowerment program. But if that's indicated elsewhere on the list, Brooke, then I think that we can save that and just note that again, that it's in the same line on the spreadsheet. But for now, this indicates that there's consensus or a majority to move the permanent supportive housing project from administration to behavioral health.
Yes, and
Correct.
now that we're talking about it, there were 4 commissioners that were in support of that financial empowerment program
Okay.
and also moving the permanent supportive housing program to the behavioral health fund.
Okay.
So,
But the cost of the permanent supportive housing project is 321,032. It does not include the financial
20,000.
empowerment.
Yes.
But when I'm looking at this, we have one, Commissioner Dorsey did not recommend doing that, and then Commissioner Anderson moved a smaller amount. 144,168. And then Commissioner Reed, you lowered the amount, but I assumed, yeah.
I'm in support.
of moving.
That could have been like a.
Make sure you unmute. So.
That could have been it could have been an accounting error because I am in support. There were a lot of numbers.
Yeah,
Okay.
totally.
All right.
Totally. And you're supportive of moving the entire 321.
Correct. I would have reflected it on a separate line if I could have, but once I figured out that it was the same line as the budget
Okay.
option for the 20,000, that's why I did the math and I made a note
Okay.
for Brooke to
Okay.
reflect that
I
math.
just wanted to make sure we were getting everybody right.
So it's really, I mean, it's moving 321 and then adding 20,000.
Right.
I mean, it's two different math problems, I guess.
Yep, you've got it. And the
Okay.
notes were very helpful on that one.
And then we still have a majority desiring to move the full housing authority and tenants to homeowners, items that we discussed to the behavioral health fund. And then I'm seeing that there's at least 4 of us who support funding the one-time request for the missed invoices from KHD. And then it looks like there's some stuff to talk about maybe on the Baldwin City EDC. Or I guess I wonder, just based on some of the conversation we had about options for where to fund that from, if there was a majority of the commission interested in that. I'm sorry,
You moved real fast on me.
sorry, I moved down to the Baldwin City EDC, the one-time funding request. It looks like there's maybe notes that trail off on your spreadsheet, Brooke. And so I'm wondering if there's something to talk about there, commissioners.
Thank you. There was some interest in moving that expense to the equipment reserve fund. I perhaps forgot to wrap that text.
Yeah, and there are differing amounts on that project. So some commissioners funded the full 500,000, some funded less than the full amount.
I think my suggestion was using the EDC initiative funding of whatever it is, 438,000 or 400 and change rather than full 500.
And I recommended also coming from the equipment reserve for EDC and doing 250,000 to kind of flag that conversation. I do think that I wasn't here for the ARPA conversations, but I think if this sort of thing had come as an ARPA conversation, because we did fund the CCC, that it would have been a really strong request there. It felt a little different for me being outside of that cycle, being all local dollars. But so I funded it at half, but I'm open to hear what other commissioners think. But I did pull it from equipment reserve.
I funded it at the full ask, but I put in 2 options. One option was to move it to the one-time expense. Actually, I think I put in 3 options. I put one for one-time expense. Then I also bumped it down to behavioral health. And then the other option I threw in was the equipment expense. Now, knowing that equipment expense is lower than 500, gave the option of then slightly reducing it because the equipment expense is lower than 500. So we don't have 500 in that particular bucket. So there's just a couple of options there, but I would like to get as close to 500 as possible. Sarah, when you sent out the spreadsheet approximately 4 weeks ago showing the funding across the county and the funding that the county has given over the last several years, I took a look at that. The county has not invested as much in some of our other cities over the last several years. And so I just think that this is just a really good opportunity to fund this particular project since we do have the ask in front of us and to, I'm going to say like level the playing field. As we begin to have requests that come in from either Lecompton, Eudora, or Baldwin or some of our other smaller cities, I just think it's a really good opportunity for us to take a look at these requests and begin to spread those dollars out a little bit more evenly since we have had such a concerted spending effort in the city of Lawrence because we have so much need in the city of Lawrence. And so I would just, as we do have requests that come in from our other cities and we do look at some of those requests, if we have the opportunity to fund those requests and we think that there is need and we have opportunity in the budget, I would just like us to take a look at those requests.
I'm curious, did I hear you right, that you pulled a portion of it from behavioral health fund Can you kind of talk about how you
Yeah.
made that connection?
Yeah, so for me, I see it as an opportunity for us to improve well-being for those that are making that drive. So when we think about well-being and culture, for those that are having to spend more time finding childcare, just the stress that it puts on families, the stress that it puts on kiddos when they think about uh, parents being away from kids, when they think about worrying about their kids, when they think about making that drive, when they think about their kids being sick, when they just think about compassion fatigue in general, when the city of Baldwin itself knows that they have a lack of childcare, when they have a lack of also potentially childcare providers, when the facility itself may not be, um, we we heard that we did not hear that it's not up to code. We just heard that it may not be the facility itself may not. It's in the basement, I'm going to say, and so it may not be bright and airy and light, and so the kids that will have the opportunity to be in a better facility that will have light and space and I think it will just improve their well-being overall, whether it be for the kids, for the families, for the teachers. And so when I think about well-being and improving mental health overall, I just think this will be a really good opportunity for the community and for the kids and the families. And it'll improve their time with their families and open up time, I think.
I'm very sensitive to the request and the need in Baldwin City, and I think it was a very strong request, and it's why I had funding for it. I'm just curious about the wording of the ballot language that is funded, that funds behavioral health, the behavioral health fund, and if it fits or doesn't fit. And I'm in my mind, I couldn't make that connection, so I was just curious if other commissioners had or not.
I mean, I funded it in full. I looked at the amount of fund balance. This is a one-time request. I don't think it, in my mind, doesn't qualify for behavioral health. I think there are other one-time requests we have that do qualify for behavioral health. So, you know, I look at the amount of fund balance we have. It seems like, both an appeal to salt childcare. We've put ARPA funds towards childcare before, but we really haven't put Douglas County funds. But I was really impressed with the proposal because it brought in quite a bit of other revenue, that braided funding that we're looking for. And later we'll talk about Bert Nash's request as well. That's sort of what I'm looking for when we look at one-time capital funds, and it feels like we have the funds available in our fund balance to do it.
And I will share, I didn't include it on this line, not because I'm not supportive, but because I was, well, not 100% committed to an amount. I was open to the full amount. I got the sense that there was likely a majority of the commission supportive of it. So frankly, this one and the Bert Nash one-time capital pledge request were two that I left blank, not because I'm not supportive, but because I was really interested to hear where other commissioners' line of thinking was about numbers. So for this one, I think, especially given the amount of money that we have available in the Economic Development Equipment Reserve and our discussion about that and how it could be utilized and potentially closed, I think that that's an option to consider. I would support fully funding it. I think it is a strong request based on all of the other input of resources and investments from people in the community. I think there's part of me that was disappointed to hear that Baldwin City, the municipality, had not been asked to invest. But I think that there could be future opportunities for that, and would encourage that if this project really moves forward full steam ahead as it seems to be doing, that there's real consideration for how the Baldwin City government is asked to invest in it as well. But I do think it's a very strong request, and I appreciate your point, Commissioner Willie, that had the timing of this worked out with ARPA, I think it would have been something that the commission at that time was very excited about, to see that in conjunction with the child care, the Community Children's Center funding option that we had in Lawrence that's Douglas County wide, but has a Lawrence home base. So I am supportive of fully funding it. I'm interested to hear, I don't, I hear what you're saying about the possibility of behavioral health funds, but I don't think that it's a square enough fit there for me. And I want to be a little bit protective of how expansive we think of those dollars. And I do believe that, we have for one-time ask in particular, the general fund dollars and equipment reserves to support it. I'm interested to hear if other commissioners had strong thoughts about where those dollars could or should come from.
So I just want us that economic development equipment reserve, I think, is something that we're all sort of targeting and thinking about how we might move it. One of the things that is giving me a little pause on using that for this project is knowing KUIP's West Campus and that building is in some really difficult shape. If it were ever to become a space that we needed to improve upon it so we could use it for economic development, that equipment reserve was a fund that I was looking at as maybe a set amount that we could work with. I really feel like it doesn't matter where we take it from in the end. I mean, if we would just move that equipment reserve, if I understand staff correctly, to the general fund.
Yeah.
So it really doesn't matter
Right.
one way or another, but I think that was something I was thinking about and
Yeah,
just wanted to share that.
Particularly because would not be used for the original intent in which it was put into equipment reserve. I would feel better if we just moved it back to the general fund and let it fall to fund balance. So that way, I just don't want to run far. I don't want to run a fee. I don't want to upset the auditors from that perspective. So I would rather just push the 421 back into the general
Is it
fund.
421 or 438 or 450? What's the
It's
amount
421 and
421 and
Okay.
change.
now? Okay.
And commissioners, that will come back to you by resolution.
So I am supportive of the full request. I'm here. I put it in as partial, but I hear from other commissioners, and I think I was the only one at that level anyway. So I'm fine to do the for 500,000 or nearly 500,000 if we do Commissioner Dorsey's route. I used half of it, or half of that request we pulled from the equipment reserve, with the idea that I think in the next year or two we're going to have a plan for that. And I just think there's a lot working through the EDC Douglas County wide that I think may have some interesting proposals. I have no idea what that might be yet. And so I didn't really want to wipe that out. I kind of wanted us to have in our minds something that is set aside for economic development. If there is any interest at all in pulling half of it from the equipment reserve by way of the general fund and just taking the rest from fund balance, I think that would be a great way forward, but that may be complicating things.
Yeah, why don't we just figure out if you want to fund it or not, and then decide later, which it sounds like you have consensus for $500,000 in full funding for the project. And then do you really want to talk about this one equipment reserve fund project right now, or can we do that later?
Let's fund it and do it later.
I tend to agree. I think we don't need to overcomplicate it. I think the only thing I want to flag is that, hearing Brooke say that would come back to us by resolution to be able to move it, does that impact anything about the amount in the general fund we're working with today for calculations in terms of the timing of?
I mean, no, I mean, we'll do that at year end.
Okay.
When we
Okay.
do other transfers. And so to me, I just would be reluctant to try to add that dollar amount into general fund unless you're really feel like you need it right now.
No, that makes sense. I just wanted clarity.
Yeah.
Okay. I think we can move on from that
Okay.
then.
So then the next one is,
So I'll revise my position from 421 to 500.
Great. Look at that. Something else moved down to the 5 list for you, bro. As if you wanted to live edit the list. Just kidding. Okay, so the Burt Nash Youth Recovery Center capital support, I see a note of partial funding. So does that suggest that a majority of the commission suggested
we had a
part of the amount?
we had a majority of the commissioners that that recommended some funding, and then we had some that had a lower dollar amount. So we had 3 commissioners that recommended full funding at 1.5 and 1 commissioner who recommended 500,000, and then 1 commissioner who didn't put anything in.
Which was me, as stated before.
I recommended full pledge.
So did I.
Coming down to a process of elimination, I put a partial in there mostly because whether the majority of commissioners wanted to fund it or not fund it, that we had to talk about it, because I put partial, so I would be the odd one out. I really felt like this needed some conversation. It is an excellent fit for the Behavioral Health Fund. It is a one-time request. We've been waiting a year for any kind of partial resolution or plan on the previous capital funding that came to Burt Nash for the Rockledge project. And that feels very uncomfortable for me to send additional dollars in that direction until we have some answers, some conversations, and those conversations even really haven't happened very fully. Now, I would say the way that staff has crafted this request with Burt Nash is that, no dollars go out until all the other dollars are raised. That likely, in my mind, might not even be in 2027. So I think there's certainly a safety net built into this, but I just think that needed to be flagged and talk about, like, my level of discomfort with where that conversation is right now.
This is a one-time request. I like the idea that staff has proposed and that it sounded like Burt Nash was okay with, if they have to line up all the other funding. My hunch, Commissioner Willie, is that we'll have that other project somewhat resolved by the time they do generate the rest of that funding. I don't know that, but that's something that I think would be there. There's a real need in the community, and when you look at the fund balance that we currently are holding in the behavioral health sales tax, it seemed like something that we had the ability to do.
Well, I'll add myself. I mean, it already sounds like we have a majority of the commission at full funding for it. But I'd add my support to it. Also, I think, as stated before, it just wasn't. I was teetering a little bit about whether or not the full amount or smaller amount was worthwhile. But I appreciate your point, Commissioner Kelly, that we do have the fund balance to support it, and I certainly appreciate staff's responsible decision to recommend it to us as a pledge and structure it that way so that we can avoid an issue.
And I do sincerely hope that timing is as you're projecting. I think that's probably true, that we'll have some resolution for that before this funding would be drawn on. So I can go along with that.
All right. So we have consensus for that as the one-time pledge at a full amount under the Behavioral Health Fund. Okay. I'm going to recommend we move to the top of the 3s. So if you could kind of scroll over a little bit, Brooke, so because your little cursor thingy is no, the other way, so that the little nope, the other way, so that the toolbar is not, yeah, that's what I was looking for. So I'll move up to Lawrence Douglas County Fire Medical and grab that. I think that's under shared, right, Brooke?
So that was one where I wanted to make sure we talked about it. I put in a partial funding there, and I actually don't think we can fund it. And that makes me really sad. And I think we can't fund it because of the governance structure we have, that if we add to just the county portion of it, then it throws off our numbers again, and we're paying for an additional part of the entire part of the organization. I do think that there are some really important conversations to be had around community paramedicine. I think the mobile integrated health program's phenomenal and helping the entire organization there. I just think we're going to have to find either a way where LMH kicks in, or the City of Lawrence kicks in, or we start with some grant funding to get some additional staffing there. So that was my kind of reasoning behind the number that I plugged in.
I hear that, Commissioner Lee. I sort of struggled with this at first. I had decided to only support funding of the of one of the two mobile integrated health positions on the team lead. Ultimately, I decided to fund both because I think it's a very strong request. My biggest hesitation is the fact that we don't that we're in the midst of reconfiguring the governance structure and that it should, I do believe that it should be a shared cost. And it's such a critical program and it's having so much impact on so many parts of the systems and so many of our community partners being positively impacted by partnership with them that I really want to I really want to see it grow. So I was curious I funded both at full portion. Had a hunch that might not be where a majority of the commission was, but curious to understand other thoughts considering the uniqueness of this joint funding agreement and how these requests shake out versus all the other requests.
Quick question for staff. There are things that the city pays for alone in our current agreement, like prevention, isn't that fully paid for by the city,
Yep.
right? And
And there are other things that the county pays 100% of.
the county pays
Yeah.
100%. So I don't know that every expense that we see, I feel, has to go into that agreement of the percentages. I think that
Well, I guess I'm looking for clarity because
Right.
I was under the impression that a majority of the commission wanted us to try to get this expense into the shared bucket. If that is not the case, then I'll quit arguing for it because that's what, I mean, I was working in governance to try to get this in the
Sure.
shared bucket because it is currently not. It is currently 100% paid for by the county.
Yeah, and ideally, it does sound like, I mean, we heard from LDCFM staff that is impacting, the entire fire service. I also think last year we sort of set the precedent that if we feel like it's a valuable service, we need to, maybe by funding some things, we need to put pressure there on our colleagues in this agreement to do that work and to find the resources to make that happen. One of the reasons I put both of these positions in mine was the idea that we need some better data to understand how this is impacting our community, and 1 8-hour shift probably isn't giving us, and I think that's what I heard at the budget hearing, isn't giving us the data to understand how it's impacting. I still hold out hope, even though I'm told again and again that maybe it can't, that by doing some interventions like MIH, we can reduce our overall cost of fire and emergency services. I'm going to continue to put that pressure on our friends at LDCFM, but so that's why I think this is a good program and why I funded it.
I think it's a phenomenal program. I think it's the most important change we've seen in our emergency response in the last, in the time that I've been here. I think we need to lean into it and find ways to make sure that it's deployed more often and more fully. My concern is how do we pay for it and who pays for it, and how do we make sure that we're broadening that conversation, because it's across LDCFM, folks are saying like this is a stress reliever. This relieves some of the pressure on the job overhaul and the burnout. It's not just on a medical side. I think it's enormously important. I did have some kind of thoughts about there's just some paradigm shifts. I mean, this MIH is a paradigm shift from emergency transportation, but there's some kind of other pieces of that paradigm that I think still need to be moving. And one of those is whether, the 3-person team all have to be community paramedic trained to that level, or if the third person can be of a different level or a different type of training, if that's, a nurse practitioner or a community health worker or a handyman. Like there's not just, it's not just health related. That's why these things are complicated. And that's the part that I was curious about. Plus, you know, if the adding a third person, added a third vehicle or an additional vehicle, a second vehicle, that was a conversation I quite wasn't finished with. So I had some thoughts around that. If there's a way to put some money aside for that conversation. I'm the one who said we shouldn't. So I guess we'll hear from other commissioners.
I did also fully fund it. I do think that mobile integrated response is really important to this work, and I do see it as an opportunity to further head upstream. As I was also researching this, I came across I think it's an older behavioral health sales tax flyer. And in the flyer, it did talk about expanding intervention, recovery, and prevention strategies. And one of the strategies listed is around integrated crisis stabilization and supportive housing and recovery interventions. And one of them listed is expanding mobile response for the behavioral health tax. And so at least for me, it really, it is an older flyer, but at the same time, it really kind of hit on that MIH thread. And so it was one of the reasons why I really put this into the budget. And
I don't have you down as having marked it. I just want to clarify. So did you put it somewhere else?
Oh, well, it's definitely in my spreadsheet. So I
Can you
included
check
it
that
and I
for
brought
me?
it all the way down to the bottom, and I actually dropped it into the BH
Oh, okay. So
section.
you
There's
put
gonna
it in
say it, but-
behavioral health.
Oh,
Okay.
yes, I did. I funded
Okay.
it, and then I brought it down and suggested that it actually be in the behavioral health bucket.
Got it. Yeah,
Yes.
that was a hard thread for us to follow.
Oh,
so
so I
well, that's
apologize.
why we walk through this.
Yeah,
Good.
What Monday mornings are for.
there we go.
Yeah.
Yes. So I fully funded it, and then I pulled it out and I brought it all the way down to the behavioral health bucket.
Commissioner Anderson, I appreciate understanding your line of thinking, and I think you're really working to be expansive about how we, which is just an acknowledgement, and I appreciate the creative thinking. I think for me, well, for a couple of reasons, it's not a clean fit into behavioral health, although it certainly has impacts on our behavioral health system, as well as all the other public safety systems, and social services safety nets in our community. I think, the flyer that you're referencing and the language around what type of programming and systemic improvements could be supported by behavioral health sales tax funding, that mobile response is really mobile response team in the crisis continuum of care, and very specific, clinically trained and peer support led mobile response as an alternative to police and fire and EMS response. And so it's not a super specific language, it sounds like, that you're reading, and it does have some of the same words. I think there's a lot to be said for good integration of those teams, or collaboration and work amongst those teams. But MIH is quite specific to paramedicine and emergency response. And so I think it still lives pretty squarely in that budget, especially given that we have a joint Department of Fire and EMS, and it is a part of that budget. I think that it makes sense to keep it there. But it sounds like, if I'm hearing us right, we have a majority of the commission that supports both positions being funded. No, I think I heard that Commissioner Anderson.
Well, do you
Commissioner-
support if it comes out of the general fund?
I guess that's a good clarifying question.
Okay.
Okay.
All right.
Yeah, thank you. I didn't mean to jump to conclusions about that. I thought
Yes,
I
I
heard you
support it
support.
either way.
Okay.
Yes, but
Okay.
I did move it to the behavioral health bucket, but either way, I do support funding the positions.
Okay.
I guess I want to know how do you want me to approach governance? We don't need to completely determine that right now, but if you still want to argue that this be eventually moved to the shared bucket, or should I just let that go?
What did we talk about when John was here with his formulas and everything?
What do you mean?
Were those positions even mentioned at that time? I don't recall.
Yes. Yeah, he spoke to them.
And
And-
had them in the shared?
No.
Okay.
They're currently not shared.
You mean the current MIH positions are that I don't know that we had a conversation about further expansion of MIH at that time.
Well, you talked about adding the positions and we talked about, that there was governance conversations about trying to move it to shared, but that it currently is not in the shared bucket. So this cost would be 100% borne by Douglas County.
And at that
No.
time, didn't we have a majority say we liked his calculations?
I don't know. We weren't really making decisions at that point. That's what you do now. So this is the conversation.
Yeah, I think Commissioner Dorsey, you're talking back to when we had a work session earlier this spring, sort of in preparation for budget. I think we certainly didn't come to any decision making that day. To Sarah's point, I think that I remember a majority of the commission being very supportive of MIH and the potential for expansion of that. I don't remember such specific conversation about whether or not it was, how it was paid for per se. I think where I'm at is similar to Commissioner Kelly's comments earlier, in that I believe that it's if there's a majority of the commission that believes it's important to fund and it is critical infrastructure to invest in, then we lead by example and we don't hold it back just because of some uncertainty about how it will be funded. In my opinion, Sarah, I think it's still worth making the case in governance conversations that it could be considered part of the shared bucket. I think that what I heard in our budget hearing last week is that there are a couple of things on the table for that to be discussed on, and the city might have their own versions of things that they currently pay for that they want to make a case for the being included in the shared bucket. So I guess I think that that's still valid to pursue, and that deciding to fund it now because the need is there and evident, and we've already made investments in this program, that's not incongruent to me, but I can understand the tension there for staff. So I'm interested in other commissioners' thoughts.
The argument for having it shared is probably 80% of the work is going to be done in the city of Lawrence.
Those are all Douglas County residents. The response is countywide.
I understand that, but I'm saying most of the people live in Lawrence.
Well, that's not how we decide the shared bucket, according to the methodology. How we decide the shared bucket is based off of, does it provide benefits to both sides of the system, both fire and EMS? And so the argument that I was making is that fundamentally helps firefighters on fire trucks. Not just, it helps all first responders, not just EMS first responders.
Right. And both fire trucks and ambulances spend a lot of their time in Lawrence.
So, trying to find a way, I just want to brainstorm here a little bit. We have two requests. We could fund one request and not the other, and then send Sarah, as you do this governance conversation, our hope was to fund both, but we want to see the city's involvement, and that's the pressure to fund the other position. I appreciate what you're saying, Sarah, and we seem to do this often, is send you in one direction and then switch gears on you when we get something that looks really great that we want to do. So I'm wondering if maybe we have the appetite to do one position, say, and I think they prioritized it. I tried to pull it up and now I put it away. I think they prioritized it, do that one position and say, our real hope is to do both, but we'd like to see city engagement, city funding as part of the shared governance agreement. It's not a perfect percentage match. I could fall more in line with that because when we did the ambulance, we said, hey, we're doing the ambulance because we think you're going to do the rest of the new station and the staffing for the new station. So that's just an idea of a way to not get out of the thing that we think that it should be a shared cost and make sure we get some support for a service that it sounds like the majority of commissioners feel like is valuable.
I appreciate that as a direction to talk about, to fund the team lead. And my sincere hope is that we have both of these positions coming online, but I'm just a little, I just think there are more conversations to be had about what the impact is on the system as a whole. So I do want them in the shared bucket, or some portion of them, if that is a possibility.
I appreciate that suggestion, Commissioner Kelly, and I can move in that direction from a strategic point of view. As I mentioned before, I had originally, drafted to just and calculated for just including that team lead position once I sort of made my decisions everywhere else. And the numbers were where they were on my spreadsheet. I decided to add it in because ultimately I do think that the requests are both valid, but I'm supportive of the idea that I think a team lead will be a significant add for them and a stabilizing factor. I still think it goes a decent way towards being able to collect even better data to work with. And then it also provides a bit of a pressure point for the city to consider what the impact is and what their investment in that program is. Because I agree with you, Commissioner Willie, that it's been a game changer for first responders in our community so far, and that's just with a 2-person team. So I'm excited about the idea of what an expanded service can look like.
If that's the direction that the commission would like to go in, I'm in agreement. So we can go in that particular direction. I do think it's really important that we add the additional support. And so if we can encourage the city of Lawrence to be in agreement, then let's move in that direction. And if we can we could encourage maybe some of our other cities to take a look at what this might look like. I think that could also be a welcome conversation in the future, because I'm not sure that we've looked at, and maybe that's not an option.
No,
So,
no.
okay.
I would say we haven't really talked about it.
Okay, because I know we have some of those governance conversations coming up in the future. So, but I don't know if that's even an option. So, okay.
So
I think this is a good place to land then, commissioners, and it sort of holds space for all the different perspectives that the 5 of us have on this, and some further conversations and questions maybe that both Commissioner Willie and Commissioner Dorsey have in particular, that funding the project or the team lead position the highest priority only, and leaving the other one off.
okay, got it. The next one is KU Innovation Park. That is down under community partners. Doodly-doo. We have some commissioners that are interested in restoring part of the cut that was given last year in differing amounts. I've got one at 50,000 and 2 at 60, and then 2 that are not interested.
I'll speak to that. And most of what I did in the general fund, I think for me falls under economic development. That was kind of my focus for funding in the budget version that I was working on. I do think this is a really critical time for KU Innovation Park. I also want to make sure that if we've asked a community partner to for something, in this case, it was the pilot program, and then they provide it. I think that we specifically made that cut because we felt they weren't being responsive about that particular piece. I think we've accomplished that. And I think, for 2027, the funding, bringing that funding back is going to be critical to our economic development. I think it's a very strong program.
Yeah, I put this in, but maybe at a little less rate because, when we talked about a reduction in their funding last year, it was because they weren't providing the data and they didn't have the pilot project. I feel like they have brought the pilot project forward. I know staff rated it low with the caveat that we were waiting on a pilot project response. I am interested, and I couldn't figure out the math quite right because I don't know the different taxing entities who gets how much from that pilot, but do we start to back off the amount we're giving or the amount that we're allocating to KUIP based on the revenue that we're gaining from the pilot? That was one thing I was thinking about. So I don't know that that makes any sense, but it was just something I was kicking around in my head as more revenue comes in. But now that I say it out loud, it actually sounds like a double cut. So I'm not sure that's a good idea. I mean, that's why we have these little get-togethers. But yeah, that was just something that occurred to me. So that might have been why I reduced it. But I want to underline it. If we ask partners to be responsive, and Commissioner Anderson, I heard you say earlier, and I agree, we want them to be more transparent in their budget process. If we ask them to do it and then they do it and we still don't fund them, that seems like a bait and switch a little bit.
I agree. That's why I didn't touch their funding here. So I left it as is. So I hope that was clear that I meant to keep their restored funding because they did meet the pilot ask that was brought before us. So I'm in favor of restoring their funding because we made a very specific ask of them. And they met that ask. And so Commissioner Willie, I really appreciate you working with them throughout the last year and being really collaborative and working through that entire process with them. Because that's a lot and that's a big ask to ask of a community partner for them to come forward with what they brought before us last week. And it may not have, ticked every single box, but it's getting us in a particular direction that we would like to go. And so I did restore the funding. I hope that was clear because I did not mark it out. I didn't put in any parentheses.
It was not included. If you can state now which.
Okay,
whatever,
yes.
But I
So
did not.
I meant
I
to
didn't
restore
show
the
you
funding
as-
because I didn't put it in parentheses. So I hope that was clear.
No,
Okay.
okay, so we may need to talk to you afterwards because if you want to fund it, we need you to actively put it on the spreadsheet in your columns. So,
Okay. So yes, it's because I
okay.
meant to restore it because there is no red parentheses.
Okay, that was not what let's just talk through it. Yeah. But now it looks like we have a majority of the commissioners that want to put it back in at $60,000.
I tried to put it back in at 60. I'm
You
not
did.
sure. Oh,
You
okay.
did. Okay, so 60K restored. Okay. The next one is the small business development, and I'm kind of confused here. I've got two commissioners that recommend adding the supplemental, which was the supplemental for 15,000.
Yes.
And then one commissioner who recommends moving 85,000 from this line, cutting it or moving it elsewhere. Okay, but what is the total amount?
Moving the full amount I moved it down to one time. So I just moved it out of the general.
Okay,
But
what is the total on small business development? Can someone?
40 currently.
So yeah, that's why I was a little confused. 'cause
plus,
it's
didn't they have
currently
a supplemental?
40. Huh?
Yes.
Yeah,
They're
so I
asking
added
for
both
15.
together. The
40
supplemental.
plus
and the-
15 would be 55.
And the
But you have
request was-
85. Oh, so you fully funded it and moved it down one time, and I have some commissioners that just partially funded it?
Yeah, but I did a fully funded and bumped it down.
Okay, I just want to make sure I'm stating it correctly.
I funded the $15,000 supplemental as part of my kind of general economic development look for the budget.
But you were recommending it be funded at one time or?
I heard you say one time, but the request is for ongoing dollars. So I wanted to clarify that part. I don't agree that this fits in behavioral health fund. If other commissioners might, then I'm interested in that. But just to clarify, I also heard you say one time. So are you making a suggestion that we not fund their request as ongoing?
Well, I think that I heard last week that for the most part, we can consider all requests to be one time because everyone comes before us every single year. And so something can be ongoing, but something can also be one time. So because we can choose to fund something or not choose to fund something. So, and I think we have two lines below, one being the cash basis reserve and one being the behavioral health fund. And so I just dropped something below, not necessarily into the behavioral health, but into that cash basis reserve fund. So which I think I can use for one time, unless I'm misunderstanding.
So you're right. I did say
Okay.
that anything can be a one time because it comes back. But if we move it to cash basis, that means we are lowering the mill levy. If we decide to do it the following year, we'll have to increase the mill levy to, I think this is one-time ongoing funds. And so, thank you. I think this is ongoing funds, not one time. This is for, services that are rendered. I sort of hold those one-time funds really for things like capital projects, and we have a number of those in there. I do think sometimes there's a little bit of a bleed. We've had one that we'll talk about, I'm sure, later that had we've one-time funded it for 3 years, right? And so I think we have some work to do to get clarity there. But what I don't want to do is move it to one-time funds when we do think it's an ongoing, that will be asked for it again and again and again, because we'll lower the mill levy and then we'll need to bump the mill levy back up. Maybe I wasn't really clear when I explained that.
Thank you for the clarity.
I'm very supportive of this one. This is the economic development ask that I was very supportive of. It's quite a small ask, and they already do so much with so little, in my opinion, and are a really strong partner to small business owners.
I didn't include it, but I could be easily convinced because it's not a large amount here with some other thing. We've already taken something off that I had funded. So I appreciate the work that they do and think they're really helping people build businesses.
I don't think I funded this supplemental, but it's not that much one way or the other.
So we're moving from 40 to 50,000, 40 to 55,000.
55, correct.
It was-
Ongoing,
Oh, the supplemental was ongoing, not
Yes.
one time.
yes.
Yep.
Okay. All right. The next one, there was some conversations about CASA. We have some commissioners who just cut it. And it looks like we've got one that recommended moving it to the behavioral health fund. I gotta think.
Do we have 3 commissioners that recommend cutting it, or 2 commissioners
You have
recommended
two,
cut
it
and
looks like
one
you have
recommended
two that
move?
recommend cutting it and one that moved it to the behavioral health fund. So 2 commissioners that didn't weigh in at all on CASA.
Well, I didn't weigh in, but I came here ready to be convinced that it could be cut and that they do not need our money any longer. But
I'll say, I think I really appreciate the work that many of our nonprofits do, including CASA. But I do think there's a time when we need to think about when a nonprofit has matured to a certain level, that funding, and it's, we just said that 15,000 is not a ton and 20,000 is that much more. We've been slowly reducing Douglas County's investment in CASA. And when I say Douglas County, I mean Douglas County government and the taxpayers of Douglas County. And I think it's always hard to stop funding someone. And they could come back next year and say things have changed, we have a match, whatever that is. But if we're always going to hold on, even when their fund balance is strong, they have a good model for it. It's hard, but I think it's something we have to consider how to do. And we have some others that I'd like to talk about later. And I sort of previewed those on our conversation Friday. How do we help those organizations see that they'll be okay? If it's a specific match that they need for federal dollars, that's a different thing for me. But this seems like one that I'm ready to congratulate them on their maturity.
Agreed. A fantastic organization very much support them. Don't know that they need to be a community partner for Douglas County government and the staff time that it takes to kind of manage those and keep up with it. We've had for the last several years the conversation about how much cash reserve that is healthy for a nonprofit to have, and specifically to come for taxpayer dollars. And so I flagged a couple, and I think my comment in the notes as I sent to Brooke was, it doesn't feel good, but it feels right to turn some of these mature some of these nonprofits and away from the taxpayer dollars. And I think they will. The ones that I've picked out here will continue to thrive and do great work in our community. And CASA was one that I had put down for moving them on as a community partner.
Where are we?
To the commissioners, I just want to give everybody voice. The commissioners that still support funding it, do you have any comments you want to make?
I forget what I did, but I did note that their cash balance was significant.
Yeah, I think I certainly flagged on the one sheet that we have of that shows us, percentage of their budget being county funded and the percentage of fund balance to budget, that one is significant. And that I agree, Commissioner Kelly, that there has to be a opportunity for us as a commission to really consider when we signal to a community partner that we believe that they've matured past their need for our funding, that it's not a significant investment from Douglas County tax dollars in a way that helps them continue to function, but that we certainly remain open to, I loved hearing the conversation amongst those partners that day about the possibility, the fact that there had been some collaborative grant applications that have occurred before, and that there's possibility for more of that in the future. So I think that, we could see CASA back here for other things, and the idea that matching dollars or project or program specific opportunities are something that this commission is always willing to entertain, but simply maintaining operational dollars sort of in perpetuity is not an expectation that I want to set for all of our community partners.
When I read through our community partner list, I'm always kind of aware that there's phenomenal work being done across our community for nonprofits that don't get any county funding. And that doesn't mean that I don't support them or that taxpayers might not support them. It's just, we have somewhat of a little bit of a random list of folks that we have funded. And I think we're over the years have been dialing that into what things kind of specifically track with Douglas County taxpayer investments.
Okay, so it sounds like we have a majority to remove that 20,000 from the fund.
The next one is Van Gogh. We had two commissioners that recommended funding their request, and one that I think meant to move the totality of the Van Gogh funding to the Behavioral Health Fund.
Wonder who that was.
Well, this is one I do think is a good conversation to have, because I actually think it may qualify, but we would need to go back to the partner and really understand how they're using Douglas County Behavioral Health Fund dollars. I do know that they provide for social worker service, that they do that, and that may align. But, I also am a little nervous about, we have some other requests to replace loss of federal funding, and I think that can become a slippery slope really quickly. This is one that I get ready for it. I almost wonder if we move to the commissioner budget and ask for that partner to sort of reevaluate what is their ask. Can we get it to line up with our behavioral health fund? Because we think that's where they may do that work. We've had such fun with that contingency fund this year. I don't know if that's a good suggestion, but I do worry about, I included it, but I worry about setting a precedent of when you lose federal funds. And this is only a small portion of the federal funds that they will be losing from WIOA.
Yeah, I appreciate those comments, Commissioner Kelly, and I think I ended up leaving this one blank, and I've felt a lot of sort of conflict about where to land with it, and just thought it best to have a chat with my peers about it. So I have some similar thoughts to you, Commissioner Kelly. I think first of all, the $20,000 ask is such a small portion of the loss of funding that it doesn't convince me that it's impactful enough. I also, knowing the trajectory of how this story and loss of funding unfolded, and the sort of the sense of urgency is there, I think, to just try and figure out how to plug that gap, because it's how they've been operating for so long. But I think there's a real opportunity for us to talk about what our relationship to them is as a funder and a community partner, and whether or not there's some opportunity to really hone in on what the specialty of the work that they do and the uniqueness of that, and how it does intersect with quite a few of our priorities, in my opinion, and that behavioral health could be considered one of those. So I don't think that the request as it is, or the way that a community partner agreement is structured with them currently, reflects that. But I agree, Commissioner Kelly, that it's possible to have some more conversations about that opportunity that exists to maybe reimagine and restructure what our funding relationship to them is, and our understanding of the value and input that they provide to that system on behalf of youth in Douglas County. So I think that there's potential for them to become a stronger partner. I don't think that the 20K feels significant enough to me, and as it's sort of currently written, to fund it out of the general. And that is also informed in part by I'm worried about setting a precedent about, I've been, let me just be, real frank about it. I've been anticipating, that for things to be rolling downhill from the federal activity as of late. And I think that those are things we have to manage our conversations around carefully, and not set ourselves in a position to become an easy go-to for filling those gaps. That's not sustainable for Douglas County government and Douglas County taxpayers. And the difference in funding, federal funding that is received by different community partners varies quite a bit. And for some community partners, it's significant. So I am worried about us setting a precedent there, but interested in more conversation with this partner in the future.
Yeah, I funded the supplemental request kind of as my part of my economic development theme that I had going on here. But I hear that conversation about that this much of their work falls under behavioral health. And I think that's an excellent conversation for us to be having. And I hadn't thought of it there. I also found myself kind of wishing they had asked for more. I don't think that WIOA funding was a known thing in March when this request came out. I do think we need to have some conversations about what our partnership looks like there moving forward. I'm not sure that I want to put it in the parking lot and come back to it for $20,000. I would suggest maybe if commissioners are interested in covering the supplemental out of the general fund where the current community partner line is located. And then for the 2028 budget, having that kind of a deeper conversation about what that relationship looks like, and if our funding can be tailored that would make a good fit for a behavioral health fund in the future.
Commissioner Dorsey or Commissioner Anderson, do you have any thoughts based on that? Trying to make sure I get a sense of where at least three of us are.
So this is keeping it in the general fund and funding the supplemental. I want to make sure we know what we're talking about. So you're recommending funding the supplemental? Okay, you didn't have it initially.
Oh, sorry.
Okay, all right.
I changed my mind.
No, I'm just
Okay.
trying to clarify.
Yeah, that exactly. Commissioner Anderson, any thoughts?
Well, I mean, yes, I already agreed to fund the supplemental in the original ask, and I had moved it to the behavioral health. but I'm also open to more conversations too, to better understand how it truly fits with the Behavioral Health Fund. And I'd also be open to having further conversations with them this year about what it looks like to truly refine that ask and then better understand what their project needs are to see if there is more need that would then align with the behavioral health bucket for this year, then moving into next year, knowing that this request was crafted many months ago. So, and needs have changed. I'd rather not wait until 2028 to do this. So that's kind of where I'm at.
But I think I'm hearing that there's a majority of the commission that supports funding the 20,000 currently and funding it general fund ongoing as requested. And that there's also a majority of the commission that believes that there's some further conversation that could be had with this partner later in the year about programs and services and their relationship to us.
So this is funding the supplemental, moving from 20,000 to 40,000.
Yes,
Okay.
sounds like we've got a majority for that.
Yep. Okay.
All right.
All right. The next one is there were the one-time costs associated with the MIH positions. My assumption is you just want to fund the one for the team lead one time since based off of how we looked at the operations.
Yeah, I'm seeing
So-
affirmative head nods.
So then the next would be the one-time, wrong place, don't do that.
Love when a
Next-
spreadsheet jumps
Yeah,
around on you.
Yeah, the spreadsheet jumps. All right, so the next one would be the request from the National Heritage, Historical Society partners. A majority, I have 3 commissioners that funded these one time, well, let's just start with the capital improvement projects.
Are there any specific notes or differences?
Nope.
Or did you have
Looks
3
like,
commissioners fully fund both of those
yep,
time?
I got 3 commissioners that fully funded both of them without any
Okay.
unique.
That sounds simple enough to me unless the other 2 commissioners want to put any comments on the record.
Brooke, do you have a category for ones?
Yeah,
Okay, never.
yeah, there's lots of ones, Okay, so we've got 3 commissioners for the Historical Society, both one times. So then the next one,
All of that rolls up into a lump sum on the,
yes,
okay.
yeah,
Because I have a one that may enter into the overall discussion.
yeah, it's gonna get complicated later. The next one, I'm not sure, maybe Brooke, you can kind of talk about what this was, the fund balance reductions, reduction in mill levy, all of that.
Yes, thank you, Sarah. So there were some entries made to reduce fund balance in the general fund, to provide mill levy reduction, and then also to move partners that were listed in the general fund into the behavioral health fund. And so staff would be interested to earmark if we do reduce the cash basis reserve here by a specific amount, that will in fact affect the mill levy. Say if we go from that 20% targeted or 22% targeted fund balance to a lower amount, we could effectively reduce the mill levy here. And so if that was the intent,
Brooke, do you just mind scrolling over since
Oh,
this one has a lot
certainly.
of text in
Yes.
the bottom?
Yeah,
If you
and
just scroll over temporarily so I can see
really,
that
that
fully.
was just the partners that would move from the general fund to the behavioral health fund. And I think that was entered as an offset. So it was a lump of community partners. And then moving the LDCFM partners into the behavioral health fund as well.
Okay, got it. And so some of these we've talked about
Yes.
based on the one
Yeah.
time or the other lines.
Mhm.
Commissioner Anderson, is it safe to have my jump to conclusion Matt out and ask if those notes reflect your suggestion of everything to move to behavioral health? Or are there other commissioners that made any similar suggestions?
Correct. Yes, those look like majority. And we've talked about most of them, except for Peasley, Just Food, CSC. Otherwise, I think we've talked about the majority of them.
So I think, I wonder, Brooke and Sarah, I mean, since we're talking about each request line by line, I think this line is throwing me off a little bit. And I wonder, I mean, I understand it's the cash basis reserve is what ended up reflecting things, but I wonder if that's something we jump back to because we're going to end up sorting out the decision point on each of those suggestions.
I think that's fine. I just would say, commissioners, you're also responsible for your own sheets. So if we get further down this list and we miss something,
Sure.
let us know you want to talk about it, because that's part of the hard part of us interpreting what so that I'm fine with that, but you all have to then, like, and you go home tonight, oh, we didn't talk about the SNAP Ed position. I want us to talk about that. That's what I'm going to need you to bring back forward, just for example.
Okay.
Okay, so
That makes
then
sense.
the next one is then under the Behavioral Health Fund. So I'm going to scroll down there. We had support for um, the clubhouse one-time ask from two, might be more commissioners. Hold on, let me over. Yeah, I have 3 commissioners that recommended 140,000 one time for the clubhouse.
Okay. With no caveats for us to discuss.
No.
All right.
Yes, I had a question about it, so I did put it in, but I also, this is something that would this come back to us with more information as we release these funds, or is this kind of the last time that we see that?
Oh, it would come, it would have, yeah, I think you can tell me you want it to come back to you.
Yeah, I just have a lot of curiosity about the model still, and I know I watched the meeting, I wasn't present for it, so I hope that that's not what's throwing me off, but I did fund it in here.
Yeah, I think I fully expect that if that moves forward full steam ahead as planned, that there will be future conversations about at least how it's integrating into the system. Although I believe that our previous conversation about it indicated that the only anticipated ask financially of the county was for this capital investment, but certainly I think we'll have an interest in wanting to know how it's integrating into everything.
Yeah, I'll just share, Commissioner Willie, I was sort of this was one that I was teetering back and forth with because it was one time and because I knew it was come back and because I've scheduled a trip with Bob to go visit one. I think if it wasn't one time, I probably wouldn't have included it, but because it was one time, I was okay knowing it would come back to us.
Okay. So then the next one is the $200,000 for supportive housing, justice involved housing. And we have 3 commissioners that included that for funding one time.
Great. Any notes,
No notes.
comments, commissioners? Okay.
Next one would be, okay, here's where I think we get complicated. I gotta go up. DECA. Looks like we had some commissioners that wanted to fund it one time. It was asked for as one-time funding, I believe. The ask was 70,000 one time, and we have 3 commissioners that recommended funding it one time.
Well, okay then. Any other comments?
I do think we need to cease I don't think this will be one time. I don't see how adolescent treatment is a one-time expense. And I appreciate that, but I think it will be asked again. And so I didn't include it.
Same for me, Commissioner Kelly. But we have a majority, so I think we can, you did not include it?
Yes, you did.
No,
see.
not for
From what I can tell.
adolescents. I did not include, I suggested that she should go to the school.
Oh, okay. I'm sorry. Your
Yeah.
spreadsheet shows 70, so maybe we don't have a consensus on.
Mm-mm.
Okay.
So,
I
yeah.
only have two then, Commissioner Dorsey and Willie. Then if Commissioner Anderson's did not mean to fund it.
I did fund it as one time because it was a one-time request. Recognize that may become a different conversation, but I also think that those dollars are doing more good out in the community than they are not in the community. So that was my thinking behind it.
Yeah, this is one that I suggested that she should partner with the schools.
Okay. Yeah, we may have.
Do we need to double check any of the other ones? Just,
Well,
Yeah,
that's why
I
we're
think when
going
we're
through
done,
one
I
at a
think I'd
time.
like you to make sure we're going one by one
Yeah.
through your list. So so now we only have two commissioners that are supportive. Does anybody want to make a case to?
I'm a hard sell on this. I don't think that I'm going to be convinced because I seems like an ongoing request and need, and perhaps that's a future conversation to entertain, but the request on its face isn't strong enough for me.
absolutely. And it's absolutely an ongoing need, but I think that there are certain partnerships that we need to foster across our community. And this is one that I think we need to really work on with our schools. And I think that's something that we have really began to realize over the last several months. And Commissioner Kelly, I really appreciate some of the comments that you've made of recent in regards to some of the, I'm going to say, taxing dollars that might be available that I think our community partners really need to start to have conversations around. And that I think we also need to better understand what is available and what those conversations should look like so that we can start to better understand how we can partner better together.
I agree with Commissioner Willie's comments.
Okay,
All right.
good to know where we all stand.
So I have that we're not funding the adolescent treatment. Okay, the next two are both, there are three commissioners that are both support or are supportive of both family promise loan payoffs with no notes. I have three.
I don't think I supported it, and my comment would be we keep buying up houses and paying off mortgages, and we don't own any of the properties. We've purchased 2 duplexes for artists helping the homeless. We've done capital improvements for Cardinal Housing. There is an agreement there, I think, that they will provide the houses for 15 years. I'm not aware of artists helping the homeless having a conditional clause like that on their stuff. Maybe we do. I understand the reason for paying off. It provides more money for operating expense. I just wish there was some way we can ensure that the capital assets we're paying off are devoted to what we want them to be devoted to for some time.
I understand what you're saying, because last year we had the request from Heartland, our federally qualified health center, and they also had a request for a loan payoff, and we denied that request. So I'm also grappling with why do we have some requests that come before us that we approve and some requests that come before us that we deny. And so I also did not approve these requests because I'm trying to figure out what is that balance between what we approve and what we deny when it comes to some of these loan payoffs. Yeah, so I did not approve either family promise request.
I funded both of these and enthusiastically funded both of these. And I was remembering the conversation from last year about Heartland, which I was, in favor of that also. But the other commissioners had made the distinction, which I think rightfully so, that what we've invested in this way has been supportive housing only in that regard through this process. And I do think that is a good use of these the fund balance in our behavioral health. Again, I think those dollars out in the community are better than they are with us. And this is one, a partner that's they're taking in some rental income that's going directly back to programming. This goes directly back to programming. It strengthens the organizations that do the work. And those buildings, they're not owned by Douglas County, they're owned by nonprofits. So they are required by law to follow the guiding documents of their organization, which provide housing. So that doesn't give me pause for what would happen with it afterwards.
And I think we also clearly heard, though, that this is temporary shelter. So when I think about whether it be temporary shelter or emergency shelter, at least throughout the last 18 months, I've heard that is more in line with the city of Lawrence's wheelhouse and the work that they're doing. And even in the last week, when I watched the city of Lawrence city commission meeting and their budget, they re-added a new funding line item to their budget around emergency shelter that they had accidentally deleted from their budget. And it's specific to a Lawrence Douglas County emergency line item for supportive housing. And so when I think about this around temporary shelter, I still don't think that it belongs in our budget. It truly belongs in the city of Lawrence budget for this particular partnership that we have.
I was just going to add that we do have agreements with Artists Helping the Homeless, also with tenants to homeowners, that the assets that they have purchased with the county dollars, we are working on them with Cardinal, that we have first right of refusal if they're ever going to come up for sale, and that there's deed restrictions on them regarding permanent affordability. I'm happy to provide those as a follow-up, but we would do the same thing with Family Promise. The intent is to do that with Ninth Street Missionary Baptist once it's all finalized.
Would you get us that one-time capital agreement? And
Sure.
We'll get it to commissioners.
Yeah, I'm very supportive. I mean, it sounds like we already have 3 commissioners who are supportive of fully funding them as is, but just to put a point on why I think it's a valuable investment and the distinction that I make about these capital requests for housing projects, including, a family shelter, which family shelter is the model that Family Promise has does not look anything like the Lawrence Community Shelter, which is true emergency shelter, or even, frankly, the Willow Domestic Violence Center shelter, which is a little bit more transitional, but still falls squarely within the definition of emergency shelter and has some significant limitations. And Family Promise does provide a much more significant continuity of services. Also, one of these projects is specifically for their transitional housing. I think that paying off loans and saving significant money of interest, leaving an organization and a community to go to a bank is a worthwhile investment. And it does allow them to be able to reallocate those funds elsewhere. And the one-time dollars that we have available, I think that these housing projects to build up the inventory and be able to then have the lever to pull, like Jill just mentioned on the deed restrictions and the first right of refusal, like those are important strategies, I think, for Douglas County to be considering when we have these requests in front of us, because it's adding to the inventory of the spectrum of housing that we need, but specifically the different types of transitional and supportive housing we need, and the ability for us to have influence over holding on to those investments and making sure they stay in the community as is and not not be at risk of such loss because of an organization's potential, financial future.
I'm comfortable with the fit for these two projects under county funding. I think the one that Commissioner Anderson has flagged that I think needs further conversation in the community or with conversation with the city specifically is LCS, because it does, as we've divided our lanes, that falls in the city lane. I don't want to make a change to that in this budget cycle, but that is I think where the conversation could be most pointed in my opinion.
I will just agree with a lot of the comments so far. It was noted in the narrative that this would make more funding available for operations, but we didn't see a reduction in that cost to operations. Listening to some of the commissioner or some of the conversation around that, I didn't include a reduction for Family Promise because of that. Could be convinced if other commissioners felt like that was equal. I would want to follow up with Brenda, and I haven't, and I should have, about what does that additional dollars do for the organization. I do feel like anytime that when we can reduce the debt costs and turn that into operation costs, that's good for us.
Okay, so we've got 3 commissioners that recommend funding it.
That's what I hear. And I think
Okay.
just to respond quickly to you, Commissioner Kelly, I think my hope is always that the organizations will consider that that's a possibility, and that has not been a condition that we have put on these types of funds before. And I think there are a lot of variables for that, but I think that it was a good conversation for us to be had. I do believe that Family Promise put in their narratives how, specifically how much they would be saving and that would be turned back into operations. I think that they're that there will continue to be need for them to meet. And so they might not realize a real savings in cost, but they will have more capacity to spend. And it's a good opportunity for all partners to hear us say that we hope that's a consideration, and you might come back to us with a smaller request in the future because you have been able to build up more capacity and stability based on that capital investment.
I think those are good conversations that we need to have with partners. In this case, where the current agreement is over one specific position, and it didn't necessarily mean that these dollars saved would go towards that position, but and we didn't make it a condition of that. So I'd say I wouldn't hold that conversation as part of our this week's budget deliberations, but it's something we can have ongoing. This was one, and there may be others too that I flagged, that if there's a possibility of because it's a capital project, of paying that down with 2026 dollars as opposed to making it part of the 2027 budget. I don't know if that just complicates things or if I'm the only one who thinks that might be worthwhile, just in terms of if we're planning to do it, why have 6 more months worth of mortgage payments?
Most of the one times, my recommendation is that we pay for it out of 2026, just because it will allow us to have a better sense of what beginning fund balance will be. So I think, the one times that I included in the county budget, we all included in 2026.
Okay, thanks. I appreciate that.
Helpful.
Want a break?
Yep. Commissioners, I would really like a break right now before we move on to the 2s and 1s, please.
Okay.
But 5 minutes has not seemed like quite enough, so I'm gonna let's come back at 10:55. That gives us 8 minutes.
No. I have them and they don't work.
All right, we are all back. Recording is in progress again. Thank you, Robin. And with that, Brooke, are you ready to move us on to a discussion about what 2 commissioners included, Brooke and Sarah?
Yeah, so the top of the twos was the MIH position, and I think we've discussed it. The next one was for the Senior Resource Center, adjustment to the capacity. And then I do think, so we had two commissioners that recommended including that funding. And then I think I have a commissioner that recommends cutting some of base SRC. So maybe we want to just talk about that all at once. Or maybe not, since there was only one commissioner and that recommended cutting that.
Yeah, I think, frankly, for efficiency, I think not spending too much time talking about what only one commissioner
Okay.
mentioned. If they're, I mean, with just two commissioners recommending, make sure I take one thing at a time, the full compensation for existing SRC staff. And just to make sure I'm clear, that means you had three commissioners who said
Yep.
nothing.
Yes, I have two commissioners that recommended funding compression at 108,361.
I was one of those that funded the compression, and also, spoiler alert, the 0.9 FTE, but it was also tied to the change in the delinquency rate, because, as we're talking about what do we want to pay for, like all of this was filtered in my mind through being able to find those dollars elsewhere, as opposed to having it raise the mill levy. So I just want to make sure that that at least I'm kind of looking through these things and in my mind kind of try to calculate back to where we are if we don't use that tool.
Sure. Frankly, I could be convinced of the full compression. That one is, I really struggled with that one. And was curious, I didn't include it as I wanted to hear other commissioners' thoughts or see where it landed on this. I am supportive of I definitely included the 0.9 allocation. I thought that was a pretty compelling ask, and that Senior Wills is so significantly utilized, and that would make things simpler for them. So I wonder if there's any other commissioners that were on the fence about that, but it sounds like maybe, well, do we have two commissioners that said yes to the full compression?
Yeah, we have two commissioners that said yes to full compression and two commissioners who said they were supportive of the FTE increase. But if it was tied to, Commissioner Willie was one of them that had both.
Yeah.
And so if that was tied to the change in the delinquency rate, I don't know if that impacts, since we don't have consensus to do that.
Yeah, and that's kind of just another thought process I'll probably put into the budget overnight is what part of my calculations change if we don't have that lever. And I think, other folks said not interested, but also said not interested until we kind of see where else we land with things we want to pay for. So I don't know if that conversation is completely gone, or if, and I just need to figure out the math on my end, or if that might come back depending on like some things that were like the Commissioner Anderson had for behavioral health are now back in the general fund. Like, does that change the conversation? So,
well, from what I can tell right now, and Brooke will correct me, with the adjustments that you've made so far, the mill levy is already reduced by 0.268. So with my assumption is most of those transfers to the behavioral health fund. So currently, as you sit right now, the mill levy is down 0.268 until we further check all the math. So please, tentatively.
I did not fund this one. I also had questions for staff in regards to the van request. I had watched the MPO most recent meeting and saw in that both Independence Inc. and Senior Resource Center have a budget line item for van replacement in the tip. And so I have a question out in regards to what their vehicle replacement line item is in that budget, because it does look like both entities have a entire vehicle replacement budget line item in there through 2029, possibly, and maybe 2030, specific to van replacements with ramps. And so wanted to truly understand what that looks like because it's upwards of $83,000 with a local match of $17,000. And so it's similar to the ask that we have before us. And so I'm looking to understand if there's a duplicate ask here or where that $17,000 match is coming from, if any of it's coming from the county, if it's anything is coming from the city.
We'll try to follow up on that.
Yeah,
Well,
and so where that ask is also before us, and so where that sits. And then also with that, I also had a conversation with Mayor Columber and Russ with the city of Baldwin. And they are also looking at their budget, and they will be putting in their budget support for the Senior Resource Center this year and into next year as well. So was really happy to hear that they've been having conversations with Megan, and they're also looking to support the Senior Resource Center. And that's something that they have not done in the past, knowing that they do have a champion that has retired and volunteers that are aging, and their need is growing. So there is support that will be coming from the city of Baldwin for the Senior Resource Center. I don't have that amount just yet, but it is forthcoming.
I have an answer back from Jessica. Both Senior Resource Center and Independence Inc. have been awarded 5310 funds through the state grant program that awards federal fund. However, those funds require matching local funds that both Senior Resource Center and Independence Inc. have to show that they have from other sources.
On the line item of the full compression, when the Senior Resource Center became a Douglas County department, we had budgeted a certain amount of dollars for that. I worry if we don't do this compression that we're sort of creating sort of an outsider group within Douglas County. Like, you're not really part of Douglas County, you're sort of part of Douglas County, and we're not funding the wages at the same level as everybody else. And that's why I funded it.
Yeah, that's compelling to me. And like I mentioned before, I was on the fence for this and this one, and I guess this is another example of where I just waited to hear other commissioners' thoughts today. And I do think that I understand that it's it was above what was budgeted for that transition period. And I, especially my knowledge of the staff there and the experience, that it is significant. And I don't want to create a disparity there and worry that we're just going to have this as a revolving conversation otherwise. So I am supportive of funding that request, both of the ongoing requests from the Senior Resource Center, which, if I'm tracking right, Sarah, puts us at a majority of the commission supporting those two things.
I didn't support the 0.9.
Thank you.
The FTE allocation. I could be convinced of it, I suppose. To me, the most important thing was making sure we got that compression level adjusted. So
thank you for clarifying. Yeah. Forgot we're in the twos for a second.
I'm excited to hear that. I will say I'm excited to hear that Baldwin may be engaged, and that might provide some drivers that we don't currently have. So
I have us down for including ongoing funding of $108,361 for the SRC compression. And now we are talking about the $47,000 increase in FTE count for drivers. And we had 2 commissioners that were indicated support for it, but not 3 at this point.
Yeah.
All of the Eudora Library drivers are volunteers.
I don't think I have a super strong pitch, frankly, to make for the other one. I do think that, I mean, the compression pay is certainly the more significant organization-wide capacity gain for them. I think that I heard Megan's request that uncomplicates scheduling and logistics in a lot of ways for their Senior Wheels program, and makes it so that they aren't faced with days that they're scrambling to get coverage. So, but it's a relatively comparatively, I think I'm more supportive of the compression, especially hearing fellow commissioners' thoughts about that, and think that that parity is important to prioritize. Commissioner Willie, do you have any thoughts that have changed?
I'd say I did fund both. I think of the two, the compression is the more important. So if commissioners are on the fence, I would think that would be a middle ground.
Okay. So not funded. Okay. And I have two commissioners that made adjustments to the transfers outline. And I'm not clear as to why, but I haven't read all your notes. So one, Commissioner Kelly reduced transfers out by 100,000 and Commissioner Willie reduced transfers out by 1.5 million. And so I want to, should we talk, is this, maybe we,
Talk about it. Yeah.
Yeah.
Mine was smaller than that, but we'll get there.
Yeah.
Go ahead.
I mean, that 100,000, I actually had a specific program that I was targeting. And when we get to that, we can talk about that. But we transfer money out of the general fund to the behavioral health projects, not to the sales tax fund, in order for the budget to get to a flat mill levy. Staff included 900 and change, 952. As we think about, which risks we're willing to take, which levers we're willing to pull, the delinquency rate to me has a much higher risk than taking some dollars from the transfer out of the general fund to behavioral health. We have a fairly, we have money in the fund balance for the behavioral health sales tax. So that's an option. I know that we've talked in this space about some threats, and we've had some partners talk about threats to state funding for our behavioral health projects. But, if there was, to me, and it's interesting to see these two there, the delinquency rate reduction versus transfers out from the general fund, we could reduce the mill. If the goal is to reduce the mill levy to pay for things, we could take it out of that transfer to the behavioral health fund rather than take the risk on lowering the delinquency rate. We could have a higher delinquency rate, and then we'd have to make that money up down the road. It'd be much easier in my mind to make it up with the fund balance we have in the behavioral health sales tax projects than it would be to have to raise the mill levy to address a delinquency rate fault.
and I guess I thought maybe we'd come back to that at the end as we're kind of trying to figure out where you all want the mill levy to be. But I want to make sure, were you thinking along the same lines, Commissioner Willie?
Yes, and I was a little more
Okay.
drastic with it, and I did both. I did both the decrease in the delinquency rate and reduction in the dollars that go from the general fund to behavioral health fund. We can cover that when we've
Yeah.
gone through some other pieces.
Because what I'd like to do is with the changes you've already agreed to with moving certain partners to the behavioral health fund, I'd like us to recalculate what the capacity is in that this afternoon and bring that back to you tomorrow. If we could. All right, so then trying to get it, I'd love us to get through twos today, if we can. The next one is, I had two commissioners that added some funding to youth services for truancy support. One commissioner added 100,000 and one commissioner added 50,000.
I was at the 50,000, and that was it wasn't something that was asked for in this way, and so I was definitely just going to flag it for a conversation. And that was specifically to allow youth services through their truancy program to, if they find the need to hire mentoring for particular students. So I put 50,000. Mostly just to have the conversation.
I put the 100,000 thinking that we could form some kind of joint venture with USD 497 to maintain some mentoring for students.
Did you put that under the CSC line? Because I don't see it under, I just don't know I didn't see that, Commissioner.
Well, the 100, you said somebody did.
100 was,
Oh, that's you.
Oh, yeah, Patrick was the
I
other
thought I
commissioner.
did.
I don't-
Maybe I screwed up.
I don't see it, but
Um,
it could be somewhere else.
okay, well, maybe I'm messed up too. That's always a possibility, but um, I think you and I had a 30-second conversation about this, but I'm thinking that, well, I've thought this all along. Two people can't do the work of the equivalent of 7 or 8 people. I understand it's a change from mentoring to case management, but I think both are needed in some regard.
Commissioner Dorsey funded both of the CSC's requests. So you put it down below. You didn't, they put it on they put it on youth services, you put it on CSC.
Oh, okay.
So we didn't quite make the connection that that was for the same thing. So it's good that we're having the conversation.
And I also funded CSC, but I bumped it because I considered it more taking a look at it as a behavioral health for our youth. And so I moved it down to the behavioral health line, but thinking about it as truancy, but also still funded it as a kind of that mentorship.
Yeah, I put in 100,000. I don't know that that's the right number. I did hear the DA say that Kate was the special sauce when it comes to truancy. So that's one reason I put it in criminal justice services, I think, for youth. And I think there seemed to be, I heard Commissioner Dorsey say it would be nice to have some more capacity. I heard some of our partners say that they would be happy to work in a sort of a different arrangement, possibly. But what I do think is we sort of need a point person on this, and I believe that's Kate. I think she could do a fantastic job, sort of determining which services. Is it mentoring? What's the right thing for that situation, and that gives her some capacity, some additional capacity to Mr. Dorsey's issue. This is the 100,000 that I took out of. I know we'll come back to it, but this is the 100,000 because I think I'm following your thought, Commissioner Anderson. Is do we think about this as somewhat behavioral health? We might do it with a general fund transfer to instead. So that sort of was where I was thinking, instead of the way that you're thinking, just put it into behavioral health. But that was just sort of my thinking on this.
But you were not planning on funding a specific partner. This would be just to go to youth services and let them make those decisions.
That would be my preference, but I'm interested to hear what other commissioners think.
That was also my preference.
I'm flexible. I think CSC has been doing it for 30 some years, so they kind of know what they're doing to some regard. Groups can always improve and do better, but I also am not sure 100 is the right number. I think we should be discussing it with the school district.
I also agree there should be conversations with the school district, in minimal conversations with Kate. I think that is potentially maybe the direction that she would go. So I would be okay with putting it into that particular budget. I do believe that this would probably come before us.
Fairly.
Not
So that's what I
necessarily.
want to make sure I have clarity on. Because if
A lot of suggestions on the table.
yeah, if it's under youth services and it's at an amount underneath that, then that would be up to their discretion as to how they would allocate the funds for truancy support. If you want to make that decision, we need to talk about it here.
A question about that. So, like, we put money into roads and bridges and capital, you're right. And we see those requests, when they contract with someone, we see that request. Remind me of our finance policy. When does that trigger? I know there's
100,000.
So 100,000. So if we were higher than 100,000, if the whole contract, I understand that if it's a half a contract and it's 50,000, we might not see it. But if it was over 100,000, it would have to come back to us to be seen. Is that correct?
Yes, I would say and to me, it makes a difference if you're putting it in the community partner budget or if you're putting it under youth services, because the community partner budget is not subject to our personnel policies. So that's where I want to make sure we have clarity around.
So I'm less interested in picking up a re-picking up a community partner and more interested in allowing kind of this this is the first year really that the school districts, et cetera, have been engaging with us at all or engaging with this topic in ways that we've been able to see into. It doesn't mean that it didn't happen. And I think just giving some flexibility for youth services to stay in the conversation with all those entities. I'm not looking at it as that they turn around and contract for that whole amount with the partner. I would be thinking that they would, and I asked in the hearings if there's a cost per kid that could be calculated and kind of contract on the person by person. I also hope that the school districts are having the same conversation with what they would like to be doing with other partners. I also don't think I need to dictate that to them, but that was my thought, was just a pool of money similar to the risk reduction that we also budgeted for them, that they can kind of see that students need. If they already have a mentor through Big Brothers Big Sisters, that's, that could be covered here or something. Like, it doesn't have to be a single partner. I just wanted them to have the flexibility because I think that's something we've really been needing and missing.
I'd be open to cost per family because I think that was something that was also kicked around for those that do mentor families along with kiddos. So yeah, I'm open to cost per family invoicing so that we ensure that we are paying for the services that are rendered.
Do we have a consensus on a dollar amount?
I'm good with 100.
We had 3 at 100, I think, right?
I just want to clarify, but you had it in a different place.
Yeah, that's what I
So
wanted
since
to
we're all
clarify.
talking about it, I want to make sure we have clarity that this would not go on the Center for Supportive Communities line. It would go under the truancy, under youth services for truancy support, and $100,000 ongoing. Is that where our consensus is?
Well, I got another question. Could the USD 497 actually take the lead on this
On which piece?
mentoring?
Sure. But I don't know that that was the proposal that was on the table.
They certainly could, and they certainly could start mentoring before anything is turned into the district attorney's office, right? I think, like I've said before, I'm excited that so many people are engaged in this conversation as we talk about what chronic absenteeism looks at prior to the 10066 form being filed, and then what's the repercussions after that. I think we have a role to play, and I'm excited that the school districts are coming to have that conversation. That's another reason I think we need a person, a department that's sort of bringing people together around the conversation rather than multiple community partners sort of doing all the things.
And if USD 497 wants to play that role, then I would really want them to fund it versus the county funding it, or for there to be some sort of cost share. Because to Commissioner Kelly's point last week, they have at least a couple of funding streams that they are collecting tax dollars for, and I think they should be coming to the table with some of their own funding versus us funding the entire bucket if they were to be the primary lead on this particular project.
I think that was my thinking around the 50,000, is that not trying to absorb a whole program, but trying to say we're going to leave some flexibility to meet student and family needs through that process, if that seems appropriate for those families in their situation. But also that my hope is that the school districts are working before it ever comes to this scenario, and they can use whatever tools they see fit. So I still think 50,000 is enough, but I may be in the minority for that, in which case we move on.
I hear a majority on 100,000. That seems clear to me that there's support for that amount of money. I will say I think this is a generous conversation, commissioners, and I appreciate the that a majority of us are willing to invest some more dollars in this space with hopes that it helps evolve the conversation in furtherance. And certainly I hear most commissioners comfortable with it being in the criminal justice budget, even if at different amounts. Commissioner Dorsey, I just want to give you the opportunity. Do you have any specific concerns or objections to that? Are you comfortable with, you like the idea of 100K being reserved for this work and you're okay with it being in the
Yeah,
CPS
we
budget?
can work something out. Yeah.
Okay, well then I think we have we have a majority for that.
Okay. The next one, I've got, I've got one commissioner that recommended funding $50,000 for the EDC position. And then I have a commissioner that recommended cutting the EDC by 155,000. And another commissioner that maybe wanted to move it to the behavioral health fund. So let's talk about EDC.
Well, I'm the guy that cut 150,000. So
55. Yeah.
155, sorry.
And I'm your behavioral health mover.
And I didn't fund the CEO for the EDC because I don't think they're in a position at this point to evaluate actually what they need.
So I was wondering how I funded this. I had it in, I had it out, I had it in. I had a variety of thoughts on it. So I was glad to get to share those. And one of those things is that I don't think I'm ready, or that they're ready for this position at the moment. I also think that if we're putting this in the 2027 budget, that means in a year and a half, I think that conversation will evolve considerably. And my hope is that towards the end of 2027, if we had allocated the funding and if the other pieces of funding request were filling in that salary, that I wanted to make sure we could move on it if we really saw a way forward through it. I think there's some pretty exciting conversations going in the EDC, and I left this as a placeholder for that.
I felt like there's a lot happening in the EDC area right now, and I just didn't think we were quite there yet on this position. I think we need to, the chamber is in the middle of a capital campaign, which would contribute dollars to the EDC. And, I think we've got staff right now working for the EDC. And what I heard at our budget hearings was what we would be adding is more robustness to that. And for me, I felt like let's stay the course right now. I appreciate that sometimes we get, and staff did this too, we get requests that sort of say, we're thinking about this. Let's keep talking about it. And for me, this one was, let's keep talking about it. Let's understand it. I wanted to understand more about the role that the EDC versus the Lawrence Chamber is playing. They're talking about joint agreements. That meeting is until July. Until the end of July. So for me right now, it wasn't something I thought I was comfortable funding. I want the conversation to mature.
No action.
I'm a hard no on this request.
I lumped this in with the economic development because I funded a lot of things that fell under that bucket, and with the thought that we really need to be spending as much attention on the revenue side of our budget as we can, and not just what we spend money on, but how do we increase that tax base so that we're taking some of that burden off of residences. This doesn't directly translate into that, but I think it's part of that conversation. And I didn't want to remove the tool, but if that, I'm in the minority for that.
I appreciate that perspective, Commissioner Willie. I think for me, it's very murky and unclear what that return on investment is a little bit in terms of tangible dollars all the time. And to Commissioner Kelly's point, there is so much transition and change on the horizon with EDC that I want to understand how that's shaking out before we make any cuts or additions to it.
Or do you want to argue
we
your cut?
We have two issues, right? That we're talking about. One is funding a CEO position, which only one person has got it. And then we've got my uh, major cut to what we're giving them. I think my rationale is it's a new organization in effect. We're not really sure what they need. Over the last 5 years, the county has given $1 million to economic development, and what has been developed. I can't see too much this happened. So that's my rationale.
An example of some many varied perspectives amongst us. So more conversations to be had, but I don't hear any persuasion happening in any direction. So I think we just leave that one where it's at, Sarah.
Okay. So the next one then would be just food. We have two commissioners that recommend cutting 65,000 from the just food budget allocation, which would be their total current allocation.
This was one that fell into that conversation about fund balance. And we've asked for a couple of years in a row, like, is there something we're not seeing in that fund balance that makes it dedicated to a purpose? And as I know that some of their funding streams have been uncertain, and we had a request to add to it. But I also look you probably have it in front of you, it was well over a year, I believe.
Yeah, so are you talking about their fund balance?
The fund balance up as a
Yeah, I mean,
percentage of
their current fund balance is 2.8 million, and their operating is 2.2 million.
And Commissioner Anderson, I'm not sure if you were recommending elimination of this or moving it to the behavioral health fund. Okay.
I mean, one thing I appreciate that, Commissioner Willie, this wasn't one I targeted, but now I'm sort of thinking, I want to think about that a little bit. What I would rather than at that high level, and because we have a supplemental, I would rather dial it back a little bit, and sort of, I want to create a soft landing for these cutting large numbers. I think 65,000 starts to become a large number. I would have some tolerance for making some reduction there, but I also think, we're reducing, we've seen a loss of SNAP education and some of those. And so I get a little nervous about this area of support.
Yeah, I can certainly go along with that. They are at 130% of their expenses in their fund balance. Did you have a dollar amount you were recommending, or just pitch it back for conversation?
Yeah, I think I don't support the supplemental request for sort of similar reasons as stated before, about being nervous to set a precedent about replacing federal dollars when they disappear. It's not always an apples to oranges or apples to apples conversation. And there's different nuances to that. One nuance that I think is interesting about this one that makes me nervous to reduce just foods funding in general, even though I certainly flagged their fund balance, is that I think that, inflation impacts all things, right? But the impact of inflation on food is so significant and wide reaching, and the need continues to rise at a pretty significant amount. And then the interesting part about the nuance about this TFAP funding is, the point that it's not exactly a direct allocation of dollars from federal funding pools too, but it sets the tonnage and the weight and things that they don't really have any, certainly no control over, but not even really much ability to influence their ask or change their ask. It's very dictated and prescriptive. And so I'm sensitive to that factor in this with the way that the TFAP funding works. I anticipate that the food insecurity need is going to continue to rise in our current economic climate. And they've managed to hold that fund balance pretty high. And I want to encourage them that that's something that we are flagging here. I, with Commissioner Kelly, am open to some reduction, but I would want to be gradual about it. And I'd also just flag that we made a decision this time last year to say yes to their supplemental request and increase their funding partially. We only partially funded their supplemental request at that time to fill the gap a little bit that they had exhibited to us. So I think the incongruency there, I guess, stuck out to me when I was going through this line by line. So I'm open to some reduction. I don't like the idea of a total elimination of funding for them. And I'm worried about the escalating factor of food insecurity and how impactful that is on all of our other social service providers that we fund also.
And I probably flagged it last year and lost too. So is there a number being proposed?
I mean, one number I have used sometimes is just like, what's a 25% reduction? When I calculated out, that's about 16,000. That seems like a lot to me, so in 2023, as you can see in your sheets, we funded them at 50,000. That's not much of a reduction. But it does sort of, in some of the ways we've done with other community partners, sort of signaled our concerns here by making small reductions. And so I'd offer 10,000 as a possible, because I agree with Commissioner Reed. If we hadn't seen SNAP being lost and and the different types of funding this is, I think I would want a more robust reduction. But I wasn't supportive of the supplemental because they have the fund balance, right? It's an emergency that this fund balance then should address. So.
And I'm fine with that for sure. I also flagged this along with the Douglas County CASA, and I feel a little bit awkward to cut one by 20,000 and not the other one, if that's the same conversation. But that doesn't have to be the apples to apples conversation either.
Yeah, that is, I hear that tension, Commissioner Willie, is sort of the sticky space. And I think for me, that comes back to what things is this commission and, prioritized investments in. To me, the primary, food pantry, food provider for food insecure folks in our community it's a significant part of the system, and there is no all other partners that we work with rely heavily on just food as a core community partner that helps meet families and individuals' needs. I don't think the same thing can be said for CASA. It's quite niche programming, quite frankly. And yeah, I'll just leave it there.
I support full funding for Just Foods.
As do I.
I think I'm in a space of supporting the full funding as is, but not the supplemental.
Agreed.
And so I think that is what it is for now, and perhaps a conversation to be continued with that partner.
Okay. All right. The next one, we had one commissioner that recommended funding the administrative work for the partners, and then one commissioner who recommended a cut to the historical societies, but not by the same amount. So I guess I want to let Commissioner Dorsey sort of talk about what he was thinking there.
Yeah, I cut funding to the Lecompton Museum because if you look at their number of visitors per year, we fund them to the tune about $17 per visitor. And Eudora and Watkins, we fund to the tune of about $7 or $8 per visitor. So it seems to me Lecompton is out of line with some of the other museums. So I cut them back to $8 a head.
I funded the historical partners because I find that to be part of the economic development conversation. And even more so in Lecompton, they don't have a chamber, they don't have an EDC, they have a historical society that kind of functions in a variety of ways. Frankly, it's what keeps the town alive and keeps people going out to eat there, is you can do both things at once, go to the museums, go out to eat, et cetera. So I feel like it the program itself pulls an outside weight for the city of Lecompton. So but I have done those calculations in the past to kind of look at, it talks about, as we say, we've kind of taken on some partners at some arbitrary levels, and there may be some other discussions to be had there. I certainly don't want to cut them. I funded all the supplementals around the historical societies.
So those are kind of two separate conversations that we've just got one commissioner on, so I'll keep us moving.
Yeah, I think we move
Okay.
on.
Cottonwood, we had one commissioner that had a recommendation to reduce funding to Cottonwood, and one, I think you wanted to move it to the Behavioral Health Fund.
So this is just another one of the cash balances, fund balance discussion. They alluded to in their narrative, and I asked at the hearing, they have funds over their 50% goal that they could use to apply to operational costs. So I had included a little bit of a cut, signaling that, this is over 50% of their budget. Commissioner Willie sort of talked about what that was. As we think about partners and their maturity, Cottonwood is certainly a very mature partner. And so that was one I took a look at.
Yeah, and I kind of looked through their budget as I was kind of chasing that same kind of line of thought, and saw that a jump in their fund balance was due to a one-time of federal. There was some COVID funding in there that isn't going to be coming back. Also, I did look at organizations that have either a less braided funding stream just by virtue of the work that they do. I mean, they're very susceptible to federal conversations. And so I think that the fund balance in the 6-month range is pretty smart for them. And so I didn't take that as a reason to cut.
So no action on it.
Like it.
Okay. The next one is visiting nurses. Again, Commissioner Kelly wanted to do a small reduction to it, and Commissioner Anderson moved it to the Behavioral Health Fund.
Same story here. No difference. They have a large fund balance. And it's actually, if you remember from our hearings, it's a little larger than it's actually here because they have 5 million more in a restricted fund. We only asked them about unrestricted. And I'm just trying to, I'm not incredibly married to this, commissioners, but I do want us to continue to encourage partners to be thinking about what you're asking Douglas County taxpayers for when you're maintaining a very high fund balance.
But maybe there, if that's and I did hear that in their conversation also, that they have access to additional funds beyond even what's reported here. If they're a mature organization, it just depends on what kind of relationship we want to have with them as a community partner and with others as a community partner. But I'm glad to have the conversation. I don't have a strong feeling one way or the other. This wasn't one that I'd flagged and maybe should have.
Yeah, I'd say I came here open to possible reductions for both Cottonwood and visiting nurses. Like I mentioned when we were having discussions on Friday, sometimes what I get stuck on is figuring out a rationale behind what kind of number to suggest when it's a consideration of a partial reduction, and how to sort of rationalize that. To me, I personally wouldn't be comfortable reducing only one of those two partners. I think that it's a little bit of a pretty similar story for me. And one distinction I might make is that, in fact, many of the dollars for Cottonwood are considered significant operating support, whereas to me, the dollars for Visiting Nurses Association is a little bit more direct and not operational support, directly supporting the services for uninsured and underinsured folks. So there's an incongruency for me in wanting to move forward with a reduction on one and not the other. It sounds like we moved on from Cottonwood without many commissioners taking a bite out of that apple. So I'm open to it, but that's kind of where I'm at with it, is that even though Visiting Nurses Association does have a much higher fund balance proportionally, percentage wise, and what we heard in the hearing about the additional there's something I'm a little stuck on with the difference in operational support dollars for Cottonwood versus the more direct, tangible service support. That doesn't, so we may just be at a standstill there and have thoughts on the record from commissioners.
I think we need to have a bigger conversation about this and warn community partners what we're going to do over a couple of year period so they can make adjustments to the way they operate and they can plan ahead. I think I'm willing to consider reductions. I would just like the partners to know what we're going to do in advance so they can make their plans.
Yeah, no, I was just going to say I agree. Maybe some sort of like a fund balance policy, right, for community partners or, for individuals as they continue to consider submitting requests moving forward, especially if we're going to adopt standards moving forward, specific to visiting nurses. They do a lot of work in the county. I see them out there all the time. And so when I think about the services that they provide to our rural constituents, it is much needed. And I hear it all the time, how their services are so valuable. So I'm definitely not in favor of cutting their services because I know that that need is growing. And so even though they have a larger fund balance, the need is not going to go away. And we already have a caregivers shortage, and that shortage is going to continue to grow. So their balance is going to continue to be needed moving forward. So I'm definitely not in favor of cutting them this year, but truly understanding what that need is moving forward and what our fund balance policy is. I think those are more conversations that we definitely need to have.
Yeah, this totally accomplished my goal here, was just getting us to talk about maybe some clear expectations for as we continue to involve our budget requests. You know, what we expect as a fund balance. If you have, as you pointed out, a one-time influx of funds to your fund balance, that needs to be explained to us. And also, I think I lost my train of thought briefly. Understanding when they're leveraging funds. To me, that's really important, that if your fund balance is there, so you can show, and that would be true of KUIP, right? Is that part of the reason they ask for our contribution is because it helps bring in federal funds. I think we ask for that. We assume we ask for that. I don't know that partners always pick up what we're asking for. And so this conversation, I think, I'm sure partners are listening. I don't think any of us are saying that as you said, Commissioner Anderson, the services they provide are not valuable. What Cottonwood does for this community, what visiting nurses do for the community is amazing. How we sort of work as partners in that, I think, is what I'd like to continue to refine.
So I'm hearing that we're not making any adjustments on all these partners that we talked through. We just kind of talked about the fund balance conversation, except we did cut CASA. And is that something we want to revisit with this conversation in mind?
I feel that, and I appreciate you putting a point on it, Commissioner Billy. I think, to me, when I considered all of these sort of in the bucket of high fund balances, CASA stood out from the rest because we have been gradually reducing and having this conversation with them over the course of a few years. And it's a much smaller investment in the first place anyway, I think.
Thanks. I just wanted to wrap that into the full conversation.
No, that's a very valid point.
Okay.
Okay.
Moving
talk
on.
about market and merit?
Yeah. So we have two commissioners that recommend cutting the market completely.
That's a hard pass for me.
I was one of them, and I cut the market completely and moved it to merit.
A portion of it.
Yeah, I came out with a total of, I believe, 3.4 overall.
3.4 mils, so 700. Yeah, Commissioner Dorsey recommended cutting market and putting 776,562 under merit. And then Commissioner Anderson cut both.
I did. I recommended a freeze.
I'd be interested in here. I mean, my first reaction is I'm not supportive of that, but I would be interested in hearing a perspective on why I mean, we're seeing inflation increase. Why do we think our employees don't need to be, you know, compensated for those changes?
Well, our economic research paper that we used to make increases on indicated the overall raise last year was 3.7, and we gave out 6.6. This year, the forecast is, I think, 3.6 in total. So I think we overpaid last year and we're making up for it this year. That's my rationale.
I would agree. I believe last year we gave double. So last year we gave last year's and this year's. And so I think this year we have the opportunity to level set and freeze. So freeze all open positions and really take a look at some of the positions that we currently have, how those positions are working for us, and if we have an opportunity to rethink some of those roles and some of the outcomes those roles are achieving for us. And if there's, as we move through this budget, if there's an opportunity for us to create either one-time $500 rewards for all employees across the system, then let's do that. But since we did give such a large across the board 6+%, I think that was almost like a two-year jump. And so I would be comfortable with just an overall freeze for this year, which is something that we also do see with other organizations, whether it be nonprofits or corporations. You often see freezes. You often see organizations just holding, especially when the economy is not moving in the direction that we might see. And Sarah has already told us that we're potentially going to see flat sales tax. We're potentially going to see flat movement across the board. And so if that is really our projections, then I think that we can also project a freeze and see where we are at for the remainder of this year. And then next year, take a look and see if we can bring back the merit and bring back and take a look at maybe what some of those market raises might look like in the 28 budget year. And I know that is not, it's not popular. And I know people don't like to hear that. These are really uncomfortable conversations to have. But they're needed conversations to have. And it's not that the employees are not valued by any means. The work is absolutely valued. But sometimes we need to take a look at some of the roles that we have and freeze what we're currently doing or pause what we're doing and just evaluate some of the pay rates that we have and see where we have movements to adjust. Now, when I was looking at some of these roles and some of the pay scales, I do truly see that we have some individuals that are absolutely underpaid. And we do have movement to bring them up. But when we look at bringing everybody up at the same time, there's disparity there. We can't just move everybody up at the exact same time because those that are already up at a higher level are going to continue just to get even higher, and that wage disparity gap will continue to grow. So I just think we have to do it differently. And so right now I'm asking for a freeze so that we can really take a look at what we have across the board. And there are, I don't know if it's going to be reflective, but there's also one position that I'm also asking to remove because I'm just not seeing the outcomes that I'd like to see from that particular position too.
Want to check my understanding with staff. My understanding of the market increase is not that everyone got a 6% raise or that everyone got a 3%. Is that correct?
Yeah, that's correct.
Okay.
It was the variation by market is by job family. So some people got as low as 2% or 2.4%. Some got a little bit higher. So that was the average last year. And then merit is on top of that, and that they have to stay inside that pool. But some got less than 3% certainly, and some got maybe top performers got above that.
And then I thought we also heard last week that some departments do have the flexibility and then maybe acted on that flexibility to operate maybe outside of those particular guardrails because they do have that flexibility to provide whatever they want for market and merit. Did I hear that right?
I would, I would say that elected officials have more flexibility with their budget. But as the HR director said, they really generally stay in alignment with what the rest of the county is doing for the most part.
Yeah, I think it's important to not put too much weight on that. The authority option that exists within the elected officials' budgets, because that we're not seeing that that's trending in ways that are creating disparity between those departments and others. I hear what you're saying, Commissioner Anderson and Commissioner Dorsey, and I can understand on a surface level why you are pondering some of these things. I'm very uncomfortable with the idea that we would eliminate a market pool. I think that puts our competitiveness and our retention rates for county employees at significant risk. And quite frankly, it rewinds the tape and undoes all the work that staff in this commission over the past few years have done to really study and address compensation organization-wide. As one of the largest employers in the county, it was very important to me that we take a comprehensive, holistic look at how we are compensating our employees and how competitive we are to other local governments in the region and in the area. And I feel very confident and comfortable with where that compression study led us and the decisions that we made to, well, in my opinion, do a lot of correcting of wages for individuals across this organization. I think that eliminating the market pool is a risk to this organization's stability and really is not worthwhile to pursue. I think for me about the merit pool conversation, I'm interested in hearing, we started that conversation on Friday and heard some different perspectives. I would like to understand where commissioners are kind of at with the merit pool in particular. I heard Commissioner Dorsey say that with eliminating the market pool on his spreadsheet, moving some of that to bump up the percentage. Can you tell me if you had a goal of how high you thought that merit pool should be?
Did you calculate what I came up with? Oh, okay. I moved the market to 0, and then I thought I moved, you said 700 some odd thousand. I was trying to end up at 3 or 3.4. And if you've read Adam Rain's email to us all today, you got some rationale as to why some of the elected officials like that better than perhaps market.
Were any other commissioners interested in making specific changes to the merit pool? I mean, Commissioner Anderson, I want to acknowledge that you're suggesting a total elimination of both right now and a freeze. And I heard your rationale for that. Commissioner William, Commissioner Kelly, do you have thoughts specific to the merit pool?
Well, I'd like to start with the market, and I feel very strongly in favor of the market increase as budgeted. And I did budget all three of these in: market, merit, and longevity. I'm open to conversations about the merit raise because I also had funded it with a possible lever that may be off the table. That's the only reason for that. But I think it's important that we keep the staff we have. Staff turnover is incredibly expensive and loses continuity, et cetera. We're not the highest dollar employer in our region by far, and I don't want to lose ground with that. And City of Lawrence pays better than we do. Everything in Johnson County pays better than we do. I think we need to stay in the game, and we did do quite a bit of work to get us to a spot where we felt we could be as competitive as we are able. And then beyond that, we just have to make it a great place to work. So I definitely feel strongly of keeping the market at 3.4 as a pool as recommended by staff. I'd prefer to have the 1% merit raise stay also.
I think we're going to get really behind if we don't continue to work on market. You can take a pause, but if you take a pause one year, the next year you're even further behind. I remember when the state of Kansas did that, they froze everyone and it took a long time to catch up. I appreciate Commissioner Reed's point. We are one of the larger employers in Douglas County. So I think this would have not only an organizational impact, but a community impact as well. I think I want to keep the great employees that we have. I want them to feel valued. While I can say we appreciate you, I also think we have to recognize the financial pressures that they're feeling and make sure that we're paying them appropriately as the market demands. So I'm not interested in budging off the 3.4 that we have budgeted right now at a flat mill. As far as merit goes, I heard Sarah say she brought it down to get us to a flat mill. I wonder if there's some other, we keep using this phrase, levers that we can pull to raise that merit up and make that another way to recognize employees for good performance. Those are things that keep employees, that help employers, continue to motivate employees to perform highly. And so if 1% is where we land at, I understand that. But I could even, try to find a way to inch that up a little bit. I don't know that 3 is where my appetite is, but I'd just be interested as we continue conversations on some of those other lines, transfers out, or even delinquency rate. Maybe that would be a place for me to find some room there.
We all have different perspectives based on our constituents, and I got a lot of folks that are elderly living on fixed incomes. They got a 2.8% raise this year over last year. I'm guessing this coming year they'll get a 3.2 to 3.4 raise. Their property values went up an average of 4.9. My particular house went up 6.8. So even if I could get to a revenue neutral rate, I'm going to get a 2.8% raise on my taxes this year. And I got to look out for the old folks. And that's why I'm suggesting a lower increase on salaries.
Sorry, I think you meant a flat mill levy. You didn't mean a revenue neutral, because that's not the conversation we've been having here.
I know, but I'm saying even at revenue neutral, okay, I'm going to get an increase because my property went up 6.8.
So your revenue neutral would mean you paid the same thing one year as the next year. Flat mill levy would mean it would go up.
Yeah.
Yeah.
Well, if we reduced our mill levy by 4.9, I would still pay an increase.
I think,
Oh, no, I agree, not countywide.
yeah. I want to keep us focused on, and especially because we're coming up right at noon. And Sarah, I heard you say earlier you'd love to get through Tuesday, but I don't think that's on the table. So I want to wrap up I want to, I guess, at least be able to put a pin in the market merit. I think my summary so far is that I hear a majority of the commission supports leaving market as budgeted at 3.4%. I think that there's some appetite for a potential increase, for a possible majority of the commission to increase the merit pool. I have an interest in that too. I didn't include it on my budget line because I think there are so many other factors to consider, but it's one that I would like to come back to after we've gotten through all of the lines, because I do, as the commissioner who suggested or prompted the conversation on Friday, that what if we just removed the merit pool because 1% doesn't feel like enough for it to matter or to be meaningful. I'd much prefer to go the other direction and to add to it and to be able to maintain that as an important benefit for county employees, and something that I do believe is paid attention to and matters. So I have an interest in revisiting that. I think I hear a majority of the commission wants to leave it the 1% as budgeted at least, but there's a possibility that that we could find a way to increase that merit pool before we get to the end of our deliberations. Does that sound right,
I think I'm
commissioners?
probably the swing between those two conversations, and it has a lot to do with where we land for mill levy, what
Sure.
we're counting for revenues.
Yeah, that makes sense to me. Okay, Sarah, do you have any clarifying questions for us?
No, I guess what I want to, we will pick back up tomorrow morning with where we are based off of moving through this. I would say, I think we are getting to the bottom of twos that are really have a consistent into commissioners wanting to go the same direction. We'll look at that. So I guess what I would encourage is that if you have, we weren't planning on going through all the ones unless that's what you want to do. And so if I would just encourage you that if there are specific things you want to talk about with your peers, if you could bring them to the meeting tomorrow, as opposed to just us go, unless the commission wants to do it differently.
Could we get a paper printout of the
Yes.
1s, 2s, 3s, 4s, and 5s?
Yes.
Or even online.
Yeah, we will send you the compilation list, and we'll recalculate the behavioral health capacity. We will show you where your current mill levy is sitting, so we can give you those things. But I guess I want to just make sure that we're all, the commissioners are on the same page, that we can finish the twos, but I would say they're getting to kind of muddy with a lot of other things in there. And then we're not planning on walking through each of the ones unless that's what the commissioners want to do.
Sarah and commissioners, that's how I came into today thinking, is that we would go line by line, at least through the twos, because, you can swing somebody pretty easy. I think that going through line by line on the ones doesn't really make sense to me. And that, but to Sarah's point, I'm interested in, especially any commissioner who sees their one thing reflected in the list that Brooke has prepared, that you definitely want to make sure we have some discussion about, and you get your comments or concerns or thoughts on the record for all of us to hear, that we do that. But I'd prefer to do it topically. And so if each commissioner can come in knowing, of those ones, what they definitely want to have a conversation about, that I think that's the best way to navigate. Okay.
Does that work? Okay.
Any burning questions?
No.
All right. We're adjourned until 9 a.m. tomorrow. Thanks, everybody.